Okay. I begin. Yeah. Good morning, good afternoon, good evening. Your Excellencies, Honorable Ministers, Ambassadors, Delegates, Director General, in my capacity as outgoing President of the 72nd World Health Assembly, I am pleased to welcome you all to this virtual platform. Now let us turn to the high-level welcome. I have the pleasure of giving the floor to Madame Michelle Bocos, Director General Envoy of Multilateral Affairs, to facilitate this session. Madame Bocos, you have the floor, please.
Thank you very much, President. Your Excellencies, the World Health Assembly is the biggest event on the global health agenda. Each year, thousands of people, including health ministers and high-profile personalities, converge in Geneva to discuss issues of global importance, ranging from health security to universal health coverage. This year, we are meeting in a virtual platform. Nevertheless, the spirit of togetherness that characterizes the Assembly is still with us. Au nom du directeur général, le Dr Tedros, j'ai l'honneur d'accueillir les leaders mondiaux qui ont accepté de prendre part avec nous à cette assemblée historique. J'invite la première de nos 8 invités de haut niveau à prendre la parole au nom de notre pays hôte. Votre Excellence, Simonetta Myriam Sommaruga, présidente de la Confédération suisse, vous avez la parole.
Monsieur le Président, Monsieur le Directeur Général, Mesdames et Messieurs les ministres, Excellences, Mesdames et Messieurs les délégués. La crise que tous les États membres de l'Organisation mondiale de la santé sont en train de vivre est un défi majeur pour nous tous. La Suisse remercie l'OMS pour son engagement de chaque instant face à la pandémie. La Suisse exprime aussi toute sa gratitude envers le personnel de santé. Il a démontré son dévouement sans faille et son courage aux 4 coins du monde. Monsieur le Directeur général, en ces circonstances si particulières, je vous assure du soutien plein et entier de mon pays à l'OMS et je réaffirme les fondements de notre engagement, l'adhésion au multilatéralisme, la solidarité et la coopération internationale. Aujourd'hui, plus que jamais, ces fondements sont indispensables. Il s'agit de les fortifier et surtout pas de les ébranler. C'est pourquoi la Suisse travaille à constituer une coalition de pays représentant chacun une région du monde. Le but est de garantir une sécurité sanitaire universelle avec en son centre l'OMS, dépassant les clivages pour mieux protéger nos populations. Pour ce faire, il sera impératif d'analyser les mesures qu'ont prises les différents pays, ceci dans le but de renforcer le règlement sanitaire international et les échanges à venir. Par le passé, l'OMS a su tirer les leçons des épidémies qu'elle a dû affronter. Je suis convaincu que l'organisation saura également examiner de manière critique la crise actuelle pour améliorer encore sa gestion des urgences sanitaires. Pour l'heure, il est néanmoins essentiel de se concentrer sur la gestion de cette crise. L'OMS doit pouvoir se nourrir des expériences faites dans chaque pays, mais elle doit aussi pouvoir agir de manière autonome et proactive pour faire face aux urgences sanitaires. Il est tout aussi important d'assurer une grande marge de manœuvre financière à l'OMS. Aujourd'hui, l'organisation dépend à près de 80% de contributions volontaires. Posons-nous tous la question. est-il décent d'exiger tellement d'elle et de payer de manière aussi arbitraire? La crise actuelle montre à quel point il est vital de disposer d'une organisation forte, efficace et universelle, engagée sur le long terme. Or, pour que cette organisation puisse agir, elle doit disposer d'un financement durable qui lui permette de garantir de manière indépendante son expertise. Monsieur le directeur général, face à la crise que nous traversons, soyez assurés de la pleine collaboration de la Suisse. Nous tous, États membres de l'Organisation mondiale de la santé, avons pour tâche de sauver des vies, de protéger la santé de la population, de soigner les malades. Nous y parviendrons seulement si nous agissons ensemble en unissant nos forces dans un cadre multilatéral, celui de l'OMS. Je vous remercie.
Je vous remercie, Excellence. Le secrétaire général des Nations Unies, M. Antonio Guterres, nous fait le plaisir d'être avec nous aujourd'hui. Excellence, vous avez la parole.
Excellency, ladies and gentlemen, dear colleagues, thank you for this opportunity to address you on the greatest challenge of our age. The COVID-19 pandemic has demonstrated our global fragility. Despite the enormous scientific and technological advances of recent decades, a microscopic virus has brought us to our knees. We do not yet know how to eradicate, treat, or vaccinate against COVID-19. And we have no clear idea when we will be able to do these things. But the fragility exposed by the virus is not limited to our health systems. It affects all areas of our world and our institutions. The fragility of coordinated global efforts is highlighted by our failed response to the climate crisis. The fragility of our nuclear disarmament regime is shown by the ever-increasing risk of proliferation. The fragility of our web protocols is laid bare by constant breaches in cybersecurity, as cyber warfare is also already happening in a lawless international environment. COVID-19 must be a wake-up call. It is time for an end of this hubris. Our deep feelings of powerlessness must lead to greater humility. Deadly global threats require a new unity and solidarity. Excellences, Mesdames et Messieurs, chers amis, nous avons vu des expressions de solidarité, mais très peu d'unité dans notre réponse face au Covid-19. Les pays ont suivi des stratégies différentes, parfois contradictoires, et nous en payons tous les prix forts. De nombreux pays ont ignoré les recommandations de l'Organisation mondiale de la santé. En conséquence, le virus s'est répandu dans le monde entier et se dirige maintenant vers les pays du Sud, où il pourrait avoir des effets encore plus dévastateurs. Et nous risquons de nouveaux pics et de nouvelles vagues. Depuis le début de la pandémie, les Nations Unies et moi-même avons plaidé en faveur d'une réponse en 3 points. Premièrement, une intervention sanitaire complète, coordonnée et à grande échelle, guidée par l'OMS et mettant l'accent sur la solidarité avec les pays en développement. Nous devons unir nos efforts pour aider les pays les plus vulnérables et renforcer et étendre leur système de santé. Des mesures humanitaires doivent compléter ce dispositif. Nous devons également investir dans l'extension des services de santé mentale afin de faire face à l'immense souffrance psychologique causée par cette maladie, qu'il s'agisse du deuil, de la dépression, de l'anxiété ou de la peur de l'avenir. Deuxièmement, nous avons appelé à la mise en place de mesures pour faire face aux terribles conséquences économiques et sociales de la crise. Permettez-moi d'être clair. Nous ne devons pas choisir entre la réponse aux conséquences sanitaires ou aux retombées économiques et sociales de cette pandémie. Il s'agit d'une fausse dichotomie. Si nous ne contrôlons pas la propagation du virus, l'économie ne s'en remettra jamais. Ainsi, parallèlement aux mesures sanitaires, nous avons besoin d'un appui direct pour aider les ménages et les entreprises à se maintenir à flot. Il faut porter une attention toute particulière aux plus touchés, les femmes, les personnes âgées, les enfants, les bas salaires et les autres groupes vulnérables. C'est pourquoi j'ai exhorté le G20 à envisager de toute urgence un plan de relance coordonné, complet à grande échelle, représentant au moins 10% du produit intérieur brut mondial. Si les pays développés ont les moyens d'y parvenir par eux-mêmes, nous devons voir une augmentation massive des ressources disponibles pour les pays en développement. J'ai également demandé le renforcement de l'appui apporté via le Fonds monétaire international, le groupe de la Banque mondiale et d'autres institutions financières internationales. Troisièmement, il est clair que la reconstruction après la crise du Covid-19 doit aboutir à des économies plus égalitaires, plus inclusives et plus durables, et à des sociétés plus fortes et plus résilientes. Cette pandémie est une tragédie. Notre réponse à cette tragédie et notre reconstruction doivent placer les droits humains au centre. Mais nous devons aussi saisir cette occasion pour faire face à la crise climatique et pour lutter contre toutes les inégalités et notamment les lacunes ayantes de nos systèmes de protection sociale. Il s'agit d'une opportunité pour reconstruire autrement et mieux. Au lieu de revenir à des systèmes qui n'étaient plus durables, nous devons faire un bond vers un avenir qui fait place aux énergies propres par l'inclusion et l'égalité, au renforcement des filets de sécurité sociale, y compris à travers une couverture médicale universelle. Il faudra un grand effort multilatéral. J'espère que la recherche d'un vaccin pourra en être le point de départ. L'initiative ACT Accelerator est une collaboration mondiale historique visant à accélérer la recherche, la production et l'égalité d'accès aux solutions diagnostiques et thérapeutiques et aux vaccins pour le Covid-19. Il est essentiel que toute personne, où qu'elle se trouve, ait accès physiquement et financièrement à ces solutions qui constituent un bien public mondial par excellence. Nous pouvons le faire, mais le ferons-nous? Excellencies, ladies and gentlemen, dear friends, I'd like to close by paying tribute to the frontline health workers who are the heroes of this pandemic. From nurses, doctors, and midwives to technicians and administrators, millions of healthcare workers are putting themselves in harm's way every day to protect us. We owe them our deepest appreciation and solidarity. The entire United Nations family stands with the thousands of our colleagues of the World Health Organization who are working around the world to support member states in saving lives and protecting the vulnerable with guidance, training, and essential testing, treatment, and protective equipment. We thank you for your service. I saw the courage and determination of WHO personnel working to end the Ebola outbreak in the Democratic Republic of the Congo when I visited last year. It is partly or largely thanks to their efforts in very difficult and dangerous conditions that new infections have been contained and we are counting down to the end of the Ebola outbreak. The WHO is irreplaceable. It needs enhanced resources, particularly to provide support to developing countries, which must be our greatest concern. We are as strong as the weakest health systems. Protecting the developing world is not a matter of charity or generosity, but a question of enlightened self-interest. The global north cannot defeat COVID-19 unless the global south defeats it at the same time. As I said last month, and I quote, "Once we have finally turned the page on this epidemic, there must be a time to look back fully, to understand how such a disease emerged and spread its devastation so quickly across the globe, and how all those involved reacted to the crisis. The lessons learned will be essential to effectively address similar challenges as they may arise in the future. But now is not that time. Now it's a time for unity, for the international community to work together in solidarity to stop this virus and its shattering consequences." End of quote. We cannot contemplate a future of fear and insecurity. Either we get through this pandemic together or we fail. Either we stand together or we fall apart. Thank you.
Thank you, Excellency. I shall now invite the President of South Africa and current Chairperson of the African Union, His Excellency President Matamela Cyril Ramaphosa, to make his statement. South Africa, can you please join us? I think we are waiting for the connection with South Africa. Just a few more seconds, and we should have South Africa online now. While we are waiting for the connection with South Africa, we'll just show a short video again. It seems we still have a problem of connection with South Africa, so we are re-establishing the connection with South Africa. In the meantime, I welcome to speak next His Excellency President Xi Jinping, President of the People's Republic of China. Excellency, you have the floor.
大会主席先生，世界卫生组织总干事先生，各位代表，首先，我认为，在人类抗击新冠肺炎疫情的关键时刻，举行这次世卫大会具有十分重要的意义。人类正在经历第二次世界大战结束以来最严重的全球公共卫生突发事件。新冠肺炎疫情突如其来，现在已经波及210多个国家和地区，影响了70多亿人口，夺走了30余万人的宝贵生命。在此，我谨向不幸罹难者表示哀悼，向他们的家属表示慰问。人类文明史也是一部同疾病和灾难的斗争史。病毒没有国界，疫病不分种族。面对来势汹汹的新冠肺炎疫情，国际社会没有退缩，各国人民勇敢前行，守望相助，风雨同舟，展现了人间大爱，汇聚起同疫情斗争的磅礴之力。经过艰苦卓绝努力，付出巨大代价，中国有力扭转了疫情局势，维护了人民生命安全和身体健康。中方始终本着公开、透明、负责任的态度，及时向世卫组织及相关国家通报疫情信息，第一时间发布病毒基因序列等信息，毫无保留同各方分享防控和救治经验，尽己所能，为有需要的国家提供了大量支持和帮助。主席先生，现在疫情还在蔓延，防控仍需努力。我愿提出以下建议：第一，全力搞好疫情防控，这是当务之急。我们要坚持以民为本，生命至上，科学调配医疗力量和重要物资，在防护、隔离、检测、救治、追踪等重要领域采取有力举措，尽快遏制疫情在全球蔓延态势，尽力阻止疫情跨境传播。要加强信息分享，交流有益经验和做法，开展检测方法、临床救治、疫苗药物研发国际合作，并继续支持各国科学家们开展病毒源头和传播途径的全球科学研究。第二，发挥世卫组织领导作用。在谭德赛总干事带领下，世卫组织为领导和推进国际抗疫合作做出了重大贡献，国际社会对此高度赞赏。当前，国际抗疫正处于关键阶段，支持世卫组织就是支持国际抗疫合作，支持挽救生命。中国呼吁国际社会 加大对世卫组织政治支持和资金投入，调动全球资源打赢疫情阻击战。第三，加大对非洲国家支持。发展中国家，特别是非洲国家，公共卫生体系薄弱，帮助他们筑牢防线，是国际抗疫斗争重中之重。我们应该向非洲国家提供更多物资、技术、人力支持。中国已向50多个非洲国家和非盟交付了大量医疗援助物资，专门派出了5个医疗专家组。在过去70年中，中国派往非洲的医疗队为2亿多人次非洲人民提供了医疗服务。目前，常驻非洲的46支中国医疗队正在投入当地的抗疫行动。第四，加强全球公共卫生治理。人类终将战胜疫情，但重大公共卫生突发事件对人类来说不会是最后一次。要针对这次疫情暴露出来的短板和不足，完善公共卫生安全治理体系，提高突发公共卫生事件应急响应速度，建立全球和地区防疫物资储备中心。中国支持在全球疫情得到控制之后，全面评估全球应对疫情工作，总结经验，弥补不足。这项工作需要科学专业的态度，需要世卫组织主导，坚持客观公正原则。第五，恢复经济社会发展。有条件的国家要在做好常态化疫情防控的前提下，遵照世卫组织专业建议，有序开展复工复产复学。要加强国际宏观经济政策协调，维护全球产业链、供应链稳定畅通，尽力恢复世界经济。第六，加强国际合作。人类是命运共同体，团结合作是战胜疫情最有力的武器。这是国际社会抗击艾滋病、埃博拉、禽流感、甲型 H1N1 流感等重大疫情取得的重要经验，是各国人民合作抗疫的人间正道。主席先生，中国始终秉持构建人类命运共同体理念，既对本国人民生命安全和身体健康负责，也对全球公共卫生事业尽责。为推进全球抗疫合作，我宣布，中国将在2年内提供20亿美元国际援助，用于支持受疫情影响的国家，特别是发展中国家抗疫斗争以及经济社会恢复发展。中国将同联合国合作，在华设立全球人道主义应急仓库和枢纽，努力确保抗疫物资供应链，并建立运输和清关绿色通道。中国将建立30个中非对口医院合作机制，加快建设非洲疾控中心总部，助力 非洲提升疾病防控能力。中国新冠疫苗研发完成并投入使用后，将作为全球公共产品，为实现疫苗在发展中国家的可及性和可担负性做出中国贡献。中国将同20国集团成员一道，落实暂缓最贫困国家债务偿付倡议，并愿同国际社会一道，加大对疫情特别重、压力特别大的国家的支持力度，帮助其克服当前的困难。我呼吁，让我们携起手来，共同佑护各国人民生命和健康，共同佑护人类共同的地球家园，共同构建人类卫生健康共同体。谢谢大家。
Thank you, Excellency. J'ai le plaisir à présent de donner la parole au président de la France, Son Excellence le président Emmanuel Macron. Vous avez la parole.
Monsieur le Président de l'Assemblée mondiale de la santé, Monsieur le Secrétaire général des Nations unies, Mesdames et Messieurs les chefs d'État et de gouvernement, Monsieur le Directeur général de l'OMS, je veux vous remercier de m'avoir invité à ouvrir avec vous cette 73e Assemblée mondiale de la santé. Cette session est sans nul doute l'une des plus importantes de l'histoire de l'Organisation mondiale de la santé. Elle doit être un moment d'unité, de solidarité, mais aussi de lucidité et d'action face à la crise mondiale inédite que nous traversons tous. Souvenons-nous de ce qui a présidé à la fondation de l'OMS en 1948, bâtir un monde nouveau où chacun pourrait jouir d'une meilleure santé, parce que c'est le droit fondamental de tout être humain. Souvenons-nous des progrès aussi accomplis depuis, de tout ce que nous avons su faire ensemble avec l'OMS, avec tous les acteurs de la santé mondiale, au service de cet objectif. L'augmentation de l'espérance de vie, le recul de la mortalité infantile, l'éradication de maladies meurtrières comme la variole, le combat qui reste entier quant à lui contre la tuberculose, le paludisme ou le VIH, pour l'élargissement de l'accès aux médicaments, à la vaccination, pour le renforcement des systèmes de santé. La pandémie de Covid-19 a bouleversé nos vies, nos sociétés, a mis nos économies à l'arrêt, a aussi révélé nos vulnérabilités à tous. Elle nous a rappelé aussi, s'il le fallait, toute la valeur de la santé humaine et de ceux qui en prennent soin. Je tiens, en cette année consacrée par l'OMS aux sages-femmes et aux infirmiers, à saluer tous ceux qui, chaque jour, sont sur le terrain pour prendre soin des autres, parfois au péril de leur vie, comme l'épouvantable attaque contre une maternité en Afghanistan l'a encore montré tragiquement, il y a quelques jours. Alors, au moment où les soignants se battent contre la pandémie, au moment où les populations de tous nos pays font face avec courage, nous n'avons pas le droit de nous diviser. Nous n'avons pas le droit de nous dérober. Nous avons collectivement un devoir d'efficacité. La priorité absolue, la seule qui vaille, c'est de venir à bout de cette pandémie. Chacun de nous porte en lui une partie de la solution. États, organisations internationales, fonds spécialisés, organisations de la société civile, industrie pharmaceutique, banques de développement, citoyens. Ce n'est qu'en unissant nos forces que nous viendrons à bout de cette pandémie. Nous avons besoin de l'OMS pour son rôle irremplaçable de coordination, pour son expertise scientifique, sa connaissance du terrain. Nous avons besoin d'une OMS forte face au Covid-19. Et l'OMS, c'est nous, ce sont ses États membres. Il dépend donc de nous de lui permettre de jouer tout son rôle dans la réponse internationale aux pandémies. C'est la raison pour laquelle la France a décidé il y a quelques jours de renforcer substantiellement le soutien financier apporté à notre organisation. C'est la raison pour laquelle, aux côtés de l'OMS, avec nos partenaires européens, avec l'ensemble des acteurs de la santé mondiale, nous avons lancé l'initiative ACT-A pour soutenir massivement la recherche, accélérer le développement et permettre un accès universel aux moyens de lutte contre la pandémie. Parce que oui, un vaccin, s'il est découvert face au Covid-19, sera un bien public mondial auquel chacun devra pouvoir avoir accès. C'est une question d'efficacité. Tant que la maladie sera la réalité de quelques-uns, elle sera une menace pour tous. C'est une question de principe. La santé humaine ne se discute pas, ne se réserve pas, ne se monnaie pas. L'Europe s'engage pleinement dans la construction de la réponse internationale à la pandémie. Le 4 mai dernier, la conférence de financement organisée par la Commission européenne a permis de mobiliser 7,5 milliards d'euros au service des objectifs d'ACT-A. Avec ses partenaires internationaux, l'Europe porte dans cette session une réponse solide pour renforcer l'application du règlement sanitaire international, améliorer les systèmes d'alerte et de réaction aux urgences, renforcer la recherche, mieux comprendre en toute transparence et avec un esprit de coopération la crise à laquelle nous sommes confrontés et en tirer tous les enseignements et donc mieux y répondre. Nous devons regarder en face avec lucidité, avec exigence, ce qui a fonctionné et ce qui n'a pas fonctionné dans la gestion internationale de la crise. Nous avons l'occasion d'apporter une réponse unie à la pandémie, sans complaisance, sans accusation non fondée. Unie, exigeante, lucide, c'est notre responsabilité. J'appelle l'ensemble des membres de cette Assemblée à la responsabilité et à l'action. Au nom de ce qui a présidé à la fondation de notre organisation et au nom d'un droit fondamental de l'humanité, l'espérance.
Je vous remercie, Monsieur le Président. It's my pleasure to now invite the President of the Republic of Korea, His Excellency President Moon Jae-in. You have the floor, Excellency.
존경하는 의장님, 사무총장님, 각국 대표단 여러분, 코로나를 극복하고 새로운 희망을 만들기 위한 세계보건총회에 함께하게 되어 뜻깊습니다. 먼저 전 세계에서 코로나로 희생되신 많은 분들께 진심으로 애도와 위로의 마음을 전합니다. 또한 인류의 건강과 안전을 위해 헌신하고 있는 모든 나라의 의료진과 방역진에게 깊은 존경과 감사의 말씀을 드립니다. 나는 오늘 코로나를 이기기 위해 대한민국 국민이 선택한 모두를 위한 자유의 길을 소개하고자 합니다. 한국은 코로나의 피해를 가장 먼저 입은 나라 중 하나였고 공격적인 바이러스에 대응하는 해결책을 빠르게 찾아내야만 했습니다. 도전과 위기의 순간 한국 국민들은 담대한 선택을 했습니다. 개개인이 가지고 있는 자유를 모두를 위한 자유로 확장시켰습니다. 이웃을 바이러스를 전파하는 위험한 대상으로 여기고 봉쇄하고 차단하는 대신 나의 안전을 위해 이웃의 안전을 먼저 지켰습니다. 자유롭게 이동하고 경제활동을 지속하기 위해 자발적으로 마스크를 착용하고 사회적 거리두기에 적극 참여했습니다. 사회적 거리두기 속에서도 서로의 마음은 더욱 가까워졌습니다. 의료인들은 자원봉사로 혼신의 노력을 다했고 시민들은 나눔으로 격려했습니다. 전국 단위의 총선거에서는 엄격한 방역 절차에도 불구하고 2,900만 명이 넘는 유권자가 투표에 참여했습니다. 평상시보다 더욱 높은 투표율을 기록하면서도 한 명의 감염자 없이 민주주의의 축제를 만들어냈습니다. 이웃의 범위는 국경 너머로까지 확장되었습니다. 국경을 막지 않고 교류를 계속하는 한편 형편이 허용하는 대로 진단키트와 마스크를 비롯한 방역 물품을 나누었습니다. 높은 시민의식으로 모두를 위한 자유의 정신을 실천하며 방역의 주체가 되어준 국민들 덕분에 개방성, 투명성, 민주성의 3대 원칙이 힘을 발휘할 수 있었습니다. 정부도 신속하고 광범위한 진단검사와 창의적인 방식으로 국민의 노력을 뒷받침했습니다. 한국이 코로나에 아직 완전히 승리한 것은 아닙니다. 사회적 거리두기를 생활 속 거리두기로 전환하여 일상과 방역이 공존하도록 노력하고 있지만 아직도 산발적인 집단 감염이 이어지고 있습니다. 또한 국외에서 계속되고 있는 세계적인 대유행이 여전히 위협적입니다. 치료제와 백신이 준비되지 않는다면 또다시 새로운 대유행이 올 수도 있습니다. 그러나 우리는 분명히 알고 있습니다. 정보를 공유하고 함께 협력하는 힘은 바이러스가 갖지 못한 인류만의 힘입니다. 코로나는 인류 공동의 가치인 자유의 정신까지 위협하지만 자유의 정신에 기반한 연대와 협력이야말로 코로나와의 전쟁에서 승리할 수 있는 가장 강력한 무기입니다. 의장님, 각국 대표단 여러분, 나는 모두를 위한 자유의 정신에 입각하여 세계가 지금의 위기를 극복하고 그 이후를 대비하기 위한 3가지 제안을 하고자 합니다. 첫째, 보건 취약국가에 대한 인도적 지원을 확대하고 방역 경험을 공유해 나가야 합니다. 모두가 코로나에서 자유로워질 때까지 단 한 사람도 소외되지 않도록 함께 협력해야 합니다. 한국은 올해 총 1억 불 규모의 인도적 지원을 계획하고 있습니다. 위기 대응과 출입국 정책에 이르기까지 그동안 축적해온 경험과 데이터도 지속적으로 국제사회와 공유해 나갈 것입니다. 인류의 건강을 함께 지키기 위해 WHO와 적극 협력해 나갈 것입니다. 둘째, 백신과 치료제 개발을 위해 국경을 넘어 협력해야 합니다. 개발된 백신과 치료제는 인류를 위한 공공재로서 전 세계에 공평하게 보급되어야 할 것입니다. 한국은 백신과 치료제 개발을 위한 WHO의 노력을 전적으로 지지합니다. 한국은 세계 백신 면역 연합, 글로벌 펀드, 국제의약품 구매기구, 국제 백신 연구소의 공여국으로 참여하고 있으며 올해부터 감염병 혁신 연합에도 기여할 예정입니다. 셋째, WHO 국제보건 규칙을 비롯한 관련 규범을 빠르게 정비하고 기속력을 갖춰야 합니다. 우리는 언제라도 올 수 있는 신종 감염병 위기에 보다 신속하고 효과적으로 대응할 수 있어야 합니다. 감염병 관련 정보를 국가 간에 더욱 투명하게 공개하고 조기 경보 시스템과 협력 체계를 공동으로 구축하는 노력이 필요합니다. G20 정상회의와 아세안 플러스 3 정상회의에서 논의된 협력 방안들이 더욱 구체화될 수 있기를 바랍니다. 존경하는 의장님, 사무총장님, 각국 대표단 여러분, 위기 앞에서 인류는 각자 도생이 아니라 연대와 협력을 선택해야 합니다. 위기일수록 세계는 상호 신뢰와 포용으로 단합해야 합니다. 국제사회가 모두를 위한 자유의 가치를 더욱 굳게 공유한다면 우리는 지금의 위기 극복을 앞당기고 포스트 코로나 시대의 희망을 더 크게 키울 수 있을 것이라고 믿습니다.
Thank you very much, Excellency. We are now trying to reconnect with South Africa to listen to President Ramaphosa's speech. If you are online, can you please click on the video? I think we still have connection problems, so I will ask our next guest. Our next guest speaker is no stranger to the Health Assembly. Please join me to welcome the Chancellor of the Federal Republic of Germany, Angela Merkel. Your Excellency, you have the floor.
Sehr geehrter Herr Generaldirektor Tedros, Exzellenzen, sehr geehrte Damen und Herren. Wir erleben eine globale Krise. Fast 5 Millionen Menschen weltweit, die sich Stand heute mit dem Coronavirus infiziert haben und ebenfalls Stand heute rund 300.000 Todesfälle weltweit, außerdem geschlossene Grenzen und herbe Einschnitte im Wirtschafts- und Alltagsleben zeigen, dass kaum ein Land von der Pandemie und ihren Folgen verschont bleibt. Diese Krise kann kein Land allein lösen. Wir müssen gemeinsam handeln. Daher danke ich Ihnen allen, die Sie an der Weltgesundheitsversammlung teilnehmen, um gemeinsam nach Lösungen zu suchen. Dabei kann uns helfen, dass die Ebola-Epidemie in Westafrika im Jahre 2014 zu notwendigen Reformen der Weltgesundheitsorganisation geführt hat. Auch die G7 und die G20-Staaten haben das Thema Gesundheit zu einer Priorität gemacht. Und auf der UN-Generalversammlung im letzten Jahr haben wir den globalen Aktionsplan für ein gesundes Leben und das Wohlergehen aller Menschen verabschiedet. Gleichwohl zeigt die Coronavirus-Pandemie noch einmal besonders nachdrücklich, dass wir weltweit noch mehr tun müssen. Für bessere Frühwarnmechanismen und Präventionsmaßnahmen, für mehr Forschungskooperation, für stärkere Gesundheitssysteme. Die Weltgesundheitsorganisation ist die legitimierte globale Institution, bei der die Fäden zusammenlaufen. Weil das so ist, müssen wir immer wieder prüfen, wie wir die Abläufe in der WHO weiter verbessern können. Dazu gehört auch, für ein nachhaltiges Finanzierungssystem zu sorgen. Am dringendsten aber ist jetzt natürlich die Coronavirus-Pandemie einzudämmen. Hierfür bedarf es weltweit geeigneter Diagnostika und Therapeutika. Außerdem gilt es, einen Impfstoff zu entwickeln, der natürlich für alle zugänglich und bezahlbar sein muss. Nicht zuletzt müssen wir die vielfältigen wirtschaftlichen und sozialen Folgen der Pandemie gemeinsam abfedern. Wie wir mit der Herausforderung umgehen, wird unsere nationalen Gesellschaften wie auch die internationale Gemeinschaft prägen. Ich bin überzeugt, dass wir die Coronavirus-Pandemie überwinden werden. Je mehr wir global gemeinsam daran arbeiten, umso schneller und besser wird uns das gelingen. Ich ermuntere alle, sich daran zu beteiligen, und ich danke allen, die zum globalen Gemeinwohl beitragen.
Thank you very much, Madam Chancellor. I have the pleasure to welcome the Prime Minister of Barbados, Her Excellency Mayor Amo Motley. You have the floor, Excellency.
Good afternoon, Mr. President and distinguished delegates. Today I join with the defenders of democracy across the Caribbean Community region, the wider Americas, and indeed the small island developing states of the world, who recognize the importance of fearless, robust leadership. I speak to you from this region of the Caribbean, CARICOM as we're known, a region that is characterized by developing health systems that suffer from the same vulnerabilities as many of our countries. Low numbers of ICU beds per capita, few intensivist doctors and critical care nurses, few ventilators per capita. And regrettably, our people have a higher rate of NCDs and obesity than we would like. We have watched how COVID has decimated rich and powerful nations with strong curative care systems, killing their people, overrunning their healthcare systems, and halting business. And so early on, CARICOM decided that we cannot fight the illness and that we had to delay the arrival of COVID-19 into the region as far as possible. We mobilized all of our regional agencies, those that dealt with public health, like the Caribbean Public Health Agency, CARFA, or the modeling, like the University of the West Indies, or with our disaster preparedness and mitigation, like SEDEMA, or with the tracking and the movement of persons through our borders, like the Joint Regional Communications Center of CARICOM. The Caribbean region's economies ranks among the most travel and tourism dependent economies in the world. And this has exposed our people and our economies in a way that we have not experienced since becoming independent nations more than 50 years ago in some instances. In our own case in Barbados, our Emergency Operations Center in the Ministry of Health has been functioning since mid-January. We organized our health systems to improve access to the health service for COVID-19 patients, while at the same time reducing the risk of exposure for the most vulnerable populations through reduced movement from as early as February of this year. We repurposed an abandoned naval base into a facility for COVID patients. This expanded our access to critical care beds by over 300%. Fortunately, our investment in and our preparedness of our public health officials over the decades has permitted us to do the type of public health surveillance to detect cases, trace and quarantine contacts, isolate and treat the ill. You will forgive me if I use this opportunity to salute the public health pioneers of the Caribbean over the last 7 decades. They have been true heroes to our people. Our CARICOM heads of government adopted a whole of government and a whole of society approach. In addition, we reached to our Caribbean neighbor Cuba and received hundreds of doctors and nurses to help us. I take this opportunity to thank our brothers and sisters in Cuba and the government of the Republic of Cuba in particular for its unswerving assistance during this pandemic. It has been palpable and clear to all of our population. So, our CARICOM family banded together to lock down and ride out this first wave. And it has been a long and treacherous wave. The closing of our borders and the trebling of unemployment and the reduction of our government revenues by half have created grave challenges for many of us. Similarly, the psyche of people in our hemisphere has been disturbed. For the majority of persons under the age of 70 in the Caribbean, many of whom have never had to confront grave challenges, the world appears to be on autopilot. They wonder who is in control and where is the leadership? Where is the global cooperation that they so expected? And for too many of our citizens globally, life has become a game of roulette, betting on numbers and colors and ignoring the science that needs to underpin our actions. Nations rich and poor are seeking inspiration. This is a crisis, therefore, that strikes not only at the heart of our humanity, but also at the organization of our human societies. It is a crisis that calls for global leadership that will allow us to rebuild our humanity, our environment, and the equity so badly needed in our societies and our economies. COVID has brought many of us closer than we have ever been with each other. It has equally cast a brighter light on the inequities in our society, but then it has also allowed the earth to breathe yet again. It is why we have contended that nothing short of coordinated global leadership, not just of governments, but also from people of influence, whether from the religious or faith-based organizations or in other areas of the society, that they ought to be involved. We need a global leadership initiative that is rooted in moral leadership, more so than ever. Moral leadership that recognizes that 75 years after the United Nations was formed, it is not good enough for us to accept that people or countries can fall through the cracks. That in particular, as we reflect on the events of the last 3 months, were it not for the Pan American Health Organization, PAHO, or CARPHA, the Caribbean Public Health Agency, and more recently the WHO, we would believe that we were living in the wild, wild west that we see in movies, where only those who are strong and well endowed should survive. It is the intervening hand of these agencies that I just mentioned that has sought to move us as a region closer to a level playing field. But my friends, there is still much work to be done. Moral leadership that will finally recognize that the use of historic per capita income to determine access to concessional funds or grant funds or indeed, as I mentioned earlier, to determine fair access to the procurement of goods is unacceptable. As I have said many times, it is the equivalent of taking my blood pressure reading from 2 years ago and using it today to determine my vulnerability to a stroke. A completely useless exercise. Even when our circumstances deteriorate, there has been no review that takes into account the inherent vulnerability to which we are exposed and which prevents us from being able to access critical money or goods. In addition, the use of certain proxy criteria to access technologies, medicines, vaccines, or concessional funds would exclude vulnerable countries such as ours in the Caribbean, some in Latin America, and even in the Pacific. Why? Because we are using criteria that are more relevant to fighting problems that have little or no relevance to our current vulnerabilities and challenges. For example, we are less than 2 weeks away from the beginning of the hurricane season. Tropical Storm Arthur has already formed off of the Bahamas, well in advance of that start. Many of us are already confronting droughts and the presence of sargassum weed as a result of the climate crisis, and it is wreaking havoc in our societies. But none of these challenges are captured by per capita income or by maternal mortality rates. None of them. In addition, where there is global market failure, as is happening now, small middle-income states are at risk of not being seen or heard, or not even accessing critical goods and supplies. I take this opportunity to thank Dr. Tedros for reaching out to the Executive Director of the Global Fund last evening to advocate for the countries in the region that have been excluded from procurement through the consortium of critical COVID-19 medical supplies. We need to be included. It is also therefore clear that we need therefore additional criteria to determine equitable access and fair allocation, criteria that better take into account that vulnerability which we have. And if we're asking for the same solution for climate, for external shocks, as we are asking for the pandemic, it is because all three destroy our capacity to produce as nations and the ability of our people to survive. It is against this background, my friends, that equitable access and fair allocation of resources will allow our small states, particularly middle-income ones, dependent on travel, to be able to have access to increased supplies for testing, such that we can reopen our societies safely to intra-regional travel and thereafter to extra-regional travel. But it will also better allow us to ensure that there is a return to safe work by safe people, the least vulnerable people to COVID-19 in our countries. While we can tolerate high unemployment and severe contraction of our economies for 2 to 3 months, the consequences to our societies of prolonged shutdown are as equal as the high incidence of COVID among our population. That is why we need urgently to get access to adequate numbers of the appropriate tests, in particular the rapid tests that are affordable and reliable if we are to allow our economies and societies to reopen safely. Our small states have been suffering from high debt and low growth for decades, and we believe that there should also be more mature and relevant conversations for middle-income, small island developing states across the globe, especially as it relates to our debt obligations in the midst of this pandemic. Many countries will either have an orderly restructuring of debt, or at the very least, a debt moratorium that provides certainty for both the borrower and the lender. Or they will have a disorderly unraveling that will create a crisis both within the respective countries and within the global financial markets. These conversations must admit of greater certainty in the management of our affairs, and I pray that the global community will have the courage to allow us to have them. I say so, conscious that Barbados took a major leap of faith when we restructured our debt in the last 18 months to include natural disaster clauses in our domestic and external debt instruments that provide for greater fiscal space to be created through a moratorium on the payment of principal and a capitalization of the interests should we face a natural disaster event. The certainty that these natural disaster clauses provide is increased fiscal space. Were this provision available in the context of this pandemic, it would bring tremendous relief to those countries and better position many of us to rebuild in a post-COVID-19 environment. Let me at this juncture express my appreciation to Director General Dr. Tedros and the WHO for the recent appointments of Sir Andrew Whitty and Dr. Ngozi Okonjo-Iweala, a dear friend of the Caribbean, as special envoys for the North and South respectively for the WHO's Access to COVID-19 Tools Accelerator. It is intended that they will ensure that there's a framework for equitable access to tests, therapeutics, and a vaccine, if ever there is one. In addition, our Caribbean countries salute your inclusive leadership and recognize that without your timely interventions, the efforts of PAHO and CARFA would be stymied as we try to meet the needs of our populations. 42 years on, our community still believes that the principles of Alma Ata must mean something, that we should have equitable access to the supplies we need, that we should be able to afford to save the lives of our citizens, and that the solutions should be appropriate to our context. I must add at this point that global moral leadership also means that in aid of supporting human lives, which none of us can replace, that there ought to be a suspension of international sanctions imposed against countries. Whatever differences or difficulties we may have with each other, they can be put on pause while we wrestle to the ground this awful pandemic. For wherever it exists, it affects each and every one of us. My friends, there was life before COVID-19, and I know that there will be life after COVID-19. For this reason, even with the pandemic, we must not drop the ball on those other global health priorities that are critical to our overall development. I refer specifically to the chronic NCDs, the silent killers of diabetes and cardiovascular disease, hypertension. I refer to HIV and AIDS, and to the antimicrobial resistance that we are fighting, and the other health-related diseases that come as a result of the climate crisis. For our populations, these challenges remain real and continue to be a silent but real and present danger. Let us use the cooperation we are trying to build to also help fight these challenges. Why? Because solidarity, unity, and partnership remain enduring principles for us. These are the principles that led our Caribbean countries to embrace the pursuit of democracy in the late 1930s, just as they also were the principles that helped the world rebuild after 3 decades of challenges 75 years ago with the formation of the United Nations and the Bretton Woods institutions. I pray that we will have the fortitude to fight against these challenges of our times, relying on these same principles of solidarity, unity, and partnership. I wish the leadership and management of the World Health Organization success in its efforts to promote health, to keep the world safe, and to serve the vulnerable people of our world as it is required to do. Your mission 73 years on, after your formation, remains critical. I say to you as I leave, the world watches on with bated breath. We wish you all of the very best as you deliberate over these 2 days, for so much depends on it. Thank you.
Thank you, Excellency. We come back now to South Africa, and I invite the President of South Africa, current Chairperson of the African Union, His Excellency President Matamela Cyril Ramaphosa, to make his statement.
Thank you. I would like to welcome this opportunity to address the World Health Assembly. We are in the midst of the most serious public health emergency our world has experienced in over 100 years. containing the coronavirus pandemic has dwarfed all other issues facing the international community and individual countries. The pandemic has profound social, political, economic, and security implications for all of us. It is impacting on human health, the economies of all affected countries, and the livelihoods of millions of people. Although the virus has affected both developed and developing countries, it is the poor who suffer the most. The pandemic has highlighted the dangerous and growing inequality that exists between countries and within them. The healthcare systems of many countries are struggling to cope. Some have been weakened by underfunding and neglect. Others are under pressure because they were designed to serve the select few. The pandemic has devastated the livelihoods of millions of people in many countries. The global recovery depends on our ability to accept the reality that this virus will be with us for some time and that we need to prepare to adapt accordingly. The social distancing, hygiene, and other protocols recommended by the World Health Organization must become part of our everyday lives. Africa affirms its full support for the World Health Organization, which has been key in guiding the international response to the pandemic. The World Health Organization has been instrumental in providing guidance and support to African governments. Africa is extremely vulnerable to the ravages of this virus and needs every possible support and assistance. The African Union has taken very deliberate steps to respond to the scourge. The African Union has made a call for developing countries to be assisted in their efforts to combat the pandemic and to rebuild their economies. This assistance needs to include debt relief. It also needs to include assistance with regard to diagnostic and therapeutic medical supplies. To turn back the frontiers of the pandemic, we must also deepen international collaboration as well as solidarity around issues like research and development and investment. We fully support the initiative by the World Health Organization, together with many other governments, in assisting the developing countries. For its part, South Africa is participating in several research initiatives. We must ensure that there is equitable access to medical equipment, technologies, in all respects. In this final decade towards the attainment of the Sustainable Development Goals, we must press ahead with our goal of making universal health care a reality for all the people of the world, and no one must be left behind. The virus has demonstrated the essential value of universal health coverage, and this is where we need full solidarity. Let us continue to be bold and courageous in confronting this pandemic. Let us continue to collaborate and act in solidarity in the interests of the millions of people around the world. I thank you.
Thank you, Excellency. It is my honor to now give the floor to the Director General of the World Health Organization, Dr. Tedros. You have the floor.
Thank you, Ambassador Bokoz. President Sommaruga, President Ramaphosa, President Xi, President Macron, President Moon, Chancellor Merkel, Prime Minister Motley, Mr. Secretary General, President of the World Health Assembly, Excellencies, colleagues, and friends. I would like to start by thanking all of our distinguished guests for their support today. Thank you for taking the time to address this important assembly. Thank you for your efforts to respond to COVID-19 at home and abroad. And thank you for your strong support for WHO at this critical time. My sisters and brothers, as you know, this year is the International Year of the Nurse and the Midwife. This assembly was intended to be a moment of recognition for the incredible contribution that nurses and midwives make every day in every country. The pandemic has robbed us of that opportunity, but it has only served to illustrate why nurses, midwives, and all health workers are so important. Nurses and midwives have been on the front lines of the fight against COVID-19, putting themselves in harm's way. Many have made the ultimate sacrifice in service of humanity. Last month, WHO published the first State of the World's Nursing Report. It shows that the world is facing a shortfall of 6 million nurses to achieve and sustain universal health coverage. But it also provides a roadmap for governments to invest in nursing, to fill that gap and progress towards universal health coverage, health for all. Now, more than ever, the world needs nurses and midwives. Please join me, wherever you are, in standing to show your appreciation for these true health heroes. Thank you. Thank you. We have come together as the nations of the world to confront the defining health crisis of our time. We come in grief for those we have lost. We come with concern for those still fighting for their lives. We come with determination to triumph over this common threat. And we come with hope for the future. The world has confronted several pandemics before. This is the first caused by a coronavirus. This is a dangerous enemy with a dangerous combination of features. This virus is efficient, fast, and fatal. It can operate in the dark, spread silently if we are not paying attention, then suddenly explodes if we are not ready, and moves like a bushfire. We have seen the same pattern repeated in cities and countries the world over. We must treat this virus with the respect and attention it deserves. More than 4.5 million cases of COVID-19 have now been reported to WHO, and more than 300,000 people have lost their lives. But numbers don't even begin to tell the story of this pandemic. Each loss of life leaves a scar for families, communities, and nations. The health impacts of the pandemic extend far beyond sickness and death caused by the virus itself. The disruption to health systems threatens to unwind decades of progress against maternal and child mortality, HIV, malaria, tuberculosis, non-communicable diseases, mental health, polio, and many other of the most urgent health threats. And yet, this is so much more than a health crisis. Lives and livelihoods have been lost or upended. Hundreds of millions of people have lost their jobs. Fear and uncertainty abound. The global economy is headed for its sharpest contraction since the Great Depression. The pandemic has brought out the best and worst of humanity, fortitude and fear, solidarity and suspicion, rapport and recrimination. This contagion exposes the fault lines, inequalities, injustices, and contradictions of our modern world. It has highlighted our strengths and our vulnerabilities. Science has been hailed and scorned. Nations have come together as never before, and geopolitical divisions have been thrown into sharp relief. We have seen what's possible with cooperation and what risk without it. The pandemic is a reminder of the intimate and delicate relationship between people and planet. Any efforts to make our world safer are doomed to fail unless they address the critical interface between people and pathogens and the existential threat of climate change that's making our Earth less habitable. For all the economic, military, and technological might of nations, we have been humbled by this very small microbe. If this virus is teaching us anything, it's humility. Time for humility. 6 months ago, it would have been inconceivable to most that the world's biggest cities would fall early quiet, that shops, restaurants, schools, and workplaces would be closed, that global travel would grind to a standstill, that simply shaking hands could be life-threatening. Terms once used only by epidemiologists like reproduction number, physical distancing, and contact tracing have become common parlance. In less than 5 months, the pandemic has encircled the globe. All countries have faced challenges in coming to grips with this virus, rich and poor, large and small. Low-income countries, small island developing states, and those suffering from violence and conflict are trying to confront this threat in the most challenging of circumstances. How do you practice physical distancing when you live in crowded conditions? How do you stay at home when you have to work to feed your family? How do you practice hand hygiene when you lack clean water? Some countries are succeeding in preventing widespread community transmission. Some have issued stay-at-home orders and imposed severe social restrictions to suppress community transmission. Some are still bracing for the worst, and some are now assessing how to ease the restrictions that have exacted such a heavy social and economic toll. WHO fully understands and supports the desire of countries to get back on their feet and back to work. It's precisely because we want the fastest possible global recovery that we urge countries to proceed with caution. Countries that move too fast without putting in place the public health architecture to detect and suppress transmission run a real risk of handicapping their own recovery. Early serology studies are painting a consistent picture. Even in the worst affected regions, the proportion of the population with the telltale antibodies is no more than 20%, and in most places, less than 10%. In other words, the majority of the world's population remains susceptible to this virus. The risk remains high, and we have a long road to travel. Over the past few months, we have learned an enormous amount about how to prevent infections and save lives. But there is no single action that has made the difference. No testing alone, no contact tracing alone, not isolation, quarantine, hand hygiene, or physical distancing alone. The countries that have done well have done it all. This is the comprehensive approach that WHO has called for consistently. There is no silver bullet. There is no simple solution. There is no panacea. There is no one-size-fits-all approach. It takes hard work, fidelity to science, learning, adapting as you go, and difficult decisions, of course. But there are many common components that must be part of every national strategy. A whole of government and a whole of society response that engages and empowers people and communities to keep themselves and others safe. The commitment and capacity to find, isolate, test, and care for every case and trace and quarantine every contact, and special attention to vulnerable groups like people living in nursing homes, refugee camps, prisons, and detention centers. Since day one, WHO has stood shoulder to shoulder with countries in this darkest of hours. WHO sounded the alarm early, and we sounded it often. We notified countries, issued guidance for health workers within 10 days, and declared global health emergency, our highest level of alert, on the 30th of January. At the time, there were less than 100 cases and no deaths outside China. We have provided technical guidance and strategic advice based on the latest science and experience. We have supported countries to adapt and implement that guidance. We have shipped diagnostics, personal protective equipment, oxygen, and other medical supplies to more than 120 countries. We have trained more than 2.6 million health workers in 23 languages. We have driven research and development through the Solidarity Trial. We have called the equitable access to vaccines, diagnostics, and therapeutics through the ACT, the ACT Accelerator. We have informed, engaged, and empowered people. We have fought the infodemic, combating myths with reliable information. And we have called consistently for the two essential ingredients for conquering this virus: national unity and global solidarity. We all have lessons to learn from the pandemic. Every country and every organization must examine its response and learn from its experience. WHO is committed to transparency, accountability, and continuous improvement. For us, change is a constant. In fact, the existing independent accountability mechanisms are already in operation. since the pandemic started. The Independent Oversight Advisory Committee has today published its first report on the pandemic, with several recommendations for both the Secretariat and Member States. In that spirit, we welcome the proposed resolution before this Assembly, which calls for a stepwise process of impartial, independent, and comprehensive evaluation. To be truly comprehensive, such an evaluation must encompass the entirety of the response by all actors in good faith. So, I will initiate an independent evaluation at the earliest appropriate moment to review experience gained and lessons learned, and to make recommendations to improve national and global pandemic preparedness and response. But one thing is abundantly clear: the world must never be the same. We do not need a review to tell us that we must all do everything in our power to ensure this never happens again. Whatever lessons there are to learn from this pandemic, the greatest failing would be to not learn from them and to leave the world in the same vulnerable state it was before. If there is anything positive to come from this pandemic, it must be a safer and more resilient world. This is not a new message. Reviews after SARS, the H1N1 pandemic, and the West African Ebola epidemic highlighted shortcomings in global health security and made numerous recommendations for countries to address those gaps. Some were implemented, others went unheeded. The SARS outbreak gave rise to the revision of the international health regulations in 2005. The H1N1 pandemic saw the creation of the Pandemic Influenza Preparedness Framework, and the Ebola outbreak of 2014 and 15 led to the establishment of the Pandemic Emergency Financing Facility, the WHO Emergencies Program, and the Independent Oversight Advisory Committee. The world doesn't need another plan, another system, another mechanism, another committee, or another organization. It needs to strengthen, implement, and finance the systems and organizations it has, including WHO. Many leaders who have spoken today raised two issues: implementing, supporting WHO, and financing. The world can no longer afford the short-term amnesia that has characterized its response to health security for too long. The time has come to weave together the disparate strands of global health security into an unbreakable chain, a comprehensive framework for epidemic and pandemic preparedness. The world does not lack the tools, the science, or the resources to make it safer from pandemics. What it has lacked is the sustained commitment to use the tools, the science, and the resources it has. That must change, and it must change today. Today, I'm calling on all nations to resolve that they will do everything it takes to ensure that the 2020 coronavirus pandemic is never repeated. I'm calling on all nations to invest in strengthening and implementing the many tools at our disposal, especially the global treaty that underpins global health security, the international health regulations. To be successful, we must all commit to mutual ownership and accountability. One way to do that, proposed by the Africa Group last year, is through a system of universal periodic review, in which countries agree to a regular and transparent review of each nation's preparedness. Since my election at this Assembly, 3 years ago, I have made a priority of transforming WHO into an organization that's agile and responsive, focused on outcomes and impact. 2 years ago, I presented, and this assembly approved, the cornerstone of our transformation, WHO's 13th General Program of Work. At its heart are the ambitious triple billion targets. 1 billion more people enjoying better health and well-being, 1 billion more people benefiting from universal health coverage, and 1 billion more people better protected from health emergencies. These are the targets that the world has set itself to achieve by 2023 to get on track and stay on track for the Sustainable Development Goals. The WHO results report launched today provides a comprehensive picture of what WHO, its member states and partners have achieved in the past 2 years. On healthy populations, we have made important progress to improve the air people breathe, the food they eat, the water they drink, the roads they use, and the conditions in which they live and work are the most important actually in bringing health. On universal health coverage, the world came together last year to endorse the political declaration on UHC, an unprecedented commitment to the ideals of health for all. We have expanded access to prevention, testing, and treatment for HIV, TB, malaria, hepatitis C, hypertension, diabetes, cancer, and more. And to keep the world safe, WHO has investigated, when necessary, responded to more than 900 events in 141 countries. That includes coordinating a huge and complex response to the Ebola outbreak in the Democratic Republic of the Congo, complicated by violence, a mobile population, and a weak health system. All of these efforts have been supported by an increased focus on science, evidence, and data. In the coming year, we will launch the WHO Academy to provide training for millions more health workers around the world. And the WHO Foundation will be launched in the next few weeks to broaden WHO's donor base. I am proud of the progress WHO has made in this and many other areas. However, much work remains to be done. Even before COVID-19, the world was off track for the SDGs. The pandemic threatens to set us back even further. It exploits and exacerbates existing gaps in gender equality, poverty, hunger, and more. Already we have seen the impact of the pandemic on immunization campaigns and many other essential health services. But the challenges we face cannot be an excuse to abandon hope of achieving the triple billion targets or the SDGs. On the contrary, they must serve as motivation to redouble our efforts and to work aggressively in pursuit of the healthier, safer, fairer world we all want. Although COVID-19 is rightly the focus of the world's attention now, we must not lose focus on sustaining and accelerating other initiatives that have saved millions of lives in recent years, like the work of Gavi, the Vaccine Alliance. Over the past 20 years, Gavi has supported countries to vaccinate 760 million children, preventing more than 13 million deaths. Gavi has set an ambitious goal to immunize 300 million more children with 18 vaccines by 2025. We call on the global community to support Gavi's upcoming replenishment, hosted by the United Kingdom, to ensure it is fully funded for this life-saving work. Last week, my friend Dr. Suit from Thailand sent me a message. This is what he said. Actually, COVID has demonstrated how WHO's triple billion goals are interconnected. Universal health coverage plays big roles in the COVID response in many countries, and healthy lives mean less deaths from COVID. I couldn't agree more. COVID-19 is not just a global health emergency. It is a vivid demonstration of the fact that there is no health security without resilient health systems or without addressing the social, economic, commercial, and environmental determinants of health. More than ever, the pandemic illustrates why investing in health must be at the center of development. I will repeat this. More than ever, the pandemic illustrates why investing in health must be at the center of development. We're learning the hard way that health is not a luxury. It is a necessity. It is a necessity. Health is not a reward for development. It is a prerequisite. Health is not a cost. It's an investment. Health is a pathway to security, prosperity, and peace. My brothers and sisters, 40 years ago, the nations of the world came together under the banner of WHO to rid the world of smallpox. They showed that when solidarity triumphs over ideology, anything is possible. The COVID-19 pandemic is posing a similar threat, not just to human health, but to the human spirit. We have a long road ahead in our struggle against this virus. The pandemic has tested, strengthened, and strained the bonds of fellowship between nations, but it has not broken them. The COVID-19 pandemic is asking us two fundamental questions. What sort of world do we want? And what sort of WHO do we want? The answer to the first question will determine the answer to the second. Now, more than ever, we need a healthier world. Now, more than ever, we need a safer world. Now, more than ever, we need a fairer world. Healthy, safe, and fair. And now, more than ever, we need a stronger WHO. There is no other way forward but together. I thank you. Thank you so much.
Thank you, Director General, for your speech. This concludes the high-level welcome. And I now hand over the floor to the 72nd WHA's President. President, you have the floor.
Thank you very much, Madam. Excellencies, before I officially open the assembly, I would like to make a few remarks. As the world fights the COVID-19 pandemic, the Secretary General of UN, His Excellency Mr. Guterres, just said, Now is the time for unity. The COVID-19 pandemic is in all countries. It affects every person in the global community or all aspects of life, regionally, nationally, and globally. Our health, well-being, social life, and economic viability are challenged, even threatened. Our lockdown is necessary to keep the COVID under control, but hampers our ability to conduct our routine work. Furthermore, we expect economic recovery to take a long time. While we advocate to maintain domestic and international support for health and social programs, and expect to reduce fiscal space for them globally. Because of lower and middle income countries have less reserve, we will bear the weight of the slow economic recovery disproportionately. At the same time, we phasing out of various programs that support improving delivery and routine services. For example, we are in the transition period for Gavi graduates. Together, these all with our reaching the Sustainable Development Goal and other international targets. Thus, we are requesting flexibility during this transition period. We have heard today from a broad cross-section of leaders in their fight against COVID-19. Evident were the struggles we all face, both domestically and distribution to address the global pandemic, from France, Germany, and Switzerland in Europe to the Republic of Korea in our own region, across South Africa, and from a small island state, Barbados. The message from President Xi Jinping has inspired us so much to fight the pandemic. And we are so pleased to learn from the success of the scientists in handling the COVID-19 pandemic in the country, as well as its active participation and mobilization of global efforts to fight against the novel virus. Furthermore, China has played a significant role in providing the valuable assistance in the medical equipment and expertise to developing countries. They have also supported to the World Health Organization to take charge the global efforts and solidarity that is needed more than ever at this critical time. We highly evaluate the concept of community of health for mankind raised by President. This has demonstrated the true spirit of global partnership for humanity that China has undertaken, and we really appreciate that. Excellencies, Honorable Director General, ladies and gentlemen, with this spirit, I would like now to welcome you to the 73rd World Health Assembly. Let us now turn to election of the President. In accordance with the rules of the rules of procedure, at each regular session, Health Assembly shall elect the President and 5 Vice Presidents who shall hold office until their successors are elected. In advance of the Health Assembly, a white paper has been created which contains names of delegates proposed for consideration following consultations within their respective regions as well as their respective countries. To consider the nomination for the office of the President of the 73rd World Health Assembly, I recall that accordance with the practice of regional rotation, which the Assembly has followed for many years, the President of the 73rd World Health Assembly is chosen among the of members of the nation of the Americas. I understand that Her Excellency Ms. Barr, permanent representative of Bahamas to the United Nations Office, Geneva, is proposed for office of President of the Third World Health Assembly. Is this proposal acceptable? In the absence of any, and it appears that there are no other proposals, I suggest, in accordance with the rule of the rules of procedure, that the Assembly approve the nomination and elect President by Ambassador Ben by elected President of the 73rd Assembly. Congratulations, Ben. Thank you.
Your Excellencies, Honorable Ministers, Ambassadors, Delegates, Director General, I would like to thank this august Assembly for their trust in electing me as the President of the 73rd World Health Assembly. I would like to express my appreciation to my predecessor, Dr. Bonkong Sahavong, Minister of Health, Lao People's Democratic Republic, for his contribution to the last World Health Assembly. We shall now turn to the nomination for the offices of Vice Presidents of the Health Assembly. I would like to recall that since a delegate from a member of the region of the Americas has filled the post of president, it would be equitable to choose the vice presidents from among delegates coming from the other 5 WHO regions. In this regard, the following proposals have been received. His Excellency Mr. Li Song, People's Republic of China. Mrs. Jacqueline Lydia Mukulu, Congo. Mr. Roberto Shibata, San Marino. Dr. Akimram Elton, Sudan. Dr. Varaz Tencharo Onsa Tiem, Thailand. Before I put the proposal to decision, may I make the following request? A few delegations have raised their hands before the meeting began. Please, may I ask those delegations to lower their hands now. If a delegation wishes to request the floor, it needs to raise its hand. So, of course, it is important to proceed in an orderly fashion. So, I have just read the names of the 5 proposals for vice presidents. Are these proposals acceptable to the Assembly? I understand that the United Arab Emirates has raised their hand. I understand that their hand has been lowered. This is new for all of us, so please bear with us all. We're going to get through it. Patience, everyone. In the absence of any objections, I take it that it is the wish of the Health Assembly to elect by acclamation the 5 delegates I mentioned previously for the post of vice presidents of the 73rd World Health Assembly. I take this opportunity to congratulate the vice presidents on their election. I shall now determine by lot of order in which the vice president shall be requested to serve should the president be unable to act in between sessions. The names of the 5 vice presidents who I referred to earlier have been written down on 5 separate paper slips, which I'm going to draw by lot. Mrs. Jacqueline Lydia Mukulu, Congo. Mr. Roberto Shabata San Marino. Vice Presidents, please bear with me should I not be pronouncing your names correctly. I'm trying here. Dr. Viraj Tencharadon Ansanthiam, Thailand. I'm getting there. His Excellency Mr. Li Song, People's Republic of China. Dr. Akram Elton, Sudan. Now, it is my pleasure to deliver the presidential address. Your Excellency President Dr. Bon Kong Siatavang, Director General Dr. Tedros Adhanom Ghebreyesus, Honorable Ministers and Heads of Delegation, ladies and gentlemen. I join the Assembly in congratulating Dr. Sihathavong, Minister of Health of the Laos People's Democratic Republic, for the poise, eloquence, and order he brought to the chair of the President during the 72nd World Health Assembly. In these uncertain and challenging times facing the global community, the resolute and inspiring leadership of the Director General remains certain, and we commend you and this organization, Dr. Tedros, which requires the global mantle for a healthier, safe, and fairer world. This presidency has great meaning for the people of the Commonwealth of the Bahamas, and indeed the Caribbean community and diaspora. I would like to take this opportunity to personally thank the government and people of the Commonwealth of the Bahamas for the confidence they have shown in selecting me to serve in this post at such an historic time. It is indeed an honor and privilege. We convene the 73rd Assembly during an unprecedented time in history when the global community is faced with negative health, social, and economic effects of the spread of the coronavirus. And the Assembly convened virtually, bringing together participants from across the globe. The public health community has faced challenges in the past. Global health issues transcend national boundaries and governments and call for action on the part of the global forces that determine the health of people. However, at no time in our recent memories has there been such a global impact of a disease, placing the lives, livelihood, and learning of so many in peril, disrupting supply chains, and bringing economies to a grinding halt. Statistically, in terms of numbers, the burden of COVID-19 has risen to over 4 million confirmed cases and close to 300,000 deaths in all 6 regions of the World Health Organization. In the wake of COVID-19, we have witnessed stock markets tumbling, unemployment rising in historic highs, conditions in fragile settings exacerbated, and peace and social cohesion threatened. Over the centuries, global action has yielded countless successes for global health, improving not only longevity, but also the quality of life. Ancient Babylonian civilization herald the sewage systems designed to protect water supply from contamination and disease. The discovery of pasteurization in the 1860s was a turning point in securing the safety of food supplies. The post-World War II era gave the global health community the tuberculosis vaccine. The past 25 years have witnessed a particularly golden era of unprecedented health achievements. Child mortality cut by 47%. Maternal mortality reduced by 45%. and reversals in the spread of HIV and AIDS, malaria, and other diseases. This era of COVID-19 ushers in new technology. It requires new knowledge, new innovations, flexibility, meaningful, respectful country interactions, as well as new and greater global partnerships. The role of the World Health Organization in this time of crisis reminds us that we live in an interdependent and interconnected world, where health and well-being are shaped by circumstances, decisions, and events occurring in distant places. Bacterial and viral threats travel almost as quickly and unencumbered as email messages, Twitter, and money flows. The World Health Organization must be steadfast in guiding the response to COVID-19, and at the same time, exact a balance with its mandate to meet the challenges that threaten the survival of many people, including those with chronic non-communicable diseases. The mere nature of our explorative spirit and our humanity suggests we will overcome these challenges. We will find solutions to these current realities that confront us now and in the aftermath of COVID-19. We will embrace new lifestyles that promote good health. We will repurpose and maximize our resources. We will establish a new balance between the economic, the physical, and the psychological welfare of our citizens. While we have lost a generation of elder citizens and those with comorbidities due to COVID-19, we must be resolute to preserve those who are with us. Juggling the health welfare with the social and economic pressures confronting us signals the complexity of the moment. But we are up to the task. Successfully negotiating COVID-19 and the post-COVID era requires that we shift, we recalibrate, and make key investments. It requires that we invest more in new technologies which are accessible to the majority of the people, that we take measures to protect the most vulnerable during the epidemic, and that we address the economic aftermath of worsening inequities. The Assembly would recall that in September 2020, Hurricane Dorian, a Category 5 climatic event, mercilessly brought mass devastation on the islands of Abaco and Grand Bahama, two of the more northern islands in our archipelagic chain. For us, Dorian amassed 74 official deaths, but it displaced thousands and exacted an economic toll of $3.4 billion in damages and losses. The Bahamas has yet to recover from Dorian and does not have the luxury of dismissing COVID-19. The Bahamas must delicately strategize to mitigate the human, social, environmental, and financial fallout of Dorian and COVID-19. This is no small task, but we will not be daunted. We will rebuild strong. our resilience continues to propel us to new strengths. Despite the financial challenges, the Bahamas, as evidenced by its modeling approaches, has demonstrated the positive impact of public health measures for COVID-19. To date, the Bahamas has confirmed 96 cases of COVID-19 and 11 deaths. The number of recovered cases are at 43. There are 7 hospitalized cases. 1,814 tests have been completed. I salute the millions of healthcare workers who valiantly stood in the gap as we fought the spread of the virus and its impact on the global community. Some lost their lives. Others endured substantial emotional and mental strains, but all continue to give their best for mankind. In conclusion, the bedrock of public health remains constant. Equity, quality, whole of society approach, collaboration, and solidarity across boundaries and borders. As we deliberate over the next 2 days, I trust we will manage our time effectively and efficiently and remain resolute in our determination to aim for the greater good, the common good, the public good. Thank you. The Assembly will now consider the special procedures to regulate the conduct of the virtual de minimis meetings of the World Health Assembly, which are contained in Annex 1 of document A73/33. As we all know, the document before us today has been the subject of extensive informal consultations involving all members. May I take it that the Health Assembly is content to adopt the special procedures contained in Annex 1 of document A73/33 and to apply them to this meeting? Should any delegation wish to take the floor on this particular matter, could you please indicate now by raising your hand? I see no objection. It is so decided. I'd like to thank you for your cooperation. Now, turning to the matter of credentials, and in line with the special procedures just adopted, I would like to invite Her Excellency, Ms. Socorro Flores Lira, Permanent Representative of Mexico to the United Nations Office in Geneva, to present the report. Her Excellency, I give you the floor.
Muchas gracias, señora presidenta. En mi carácter de primera vicepresidenta de la 72ª Asamblea Mundial de la Salud, me reuní con el presidente y con otros dos vicepresidentes de la 72 Asamblea el domingo 17 de mayo de 2020 a fin de examinar las credenciales presentadas por los Estados miembros para participar en la 73 Asamblea Mundial de la Salud. Me complace informar a la Asamblea que 180 Estados miembros han presentado credenciales que se han considerado conformes al reglamento de la Asamblea. Por consiguiente, recomiendo a la Asamblea que se acepte que los 180 Estados miembros mencionados presentaron credenciales de conformidad con dicho reglamento. Además de este informe oral, he sido informada que desde la reunión de ayer con los miembros de la mesa de la 72 Asamblea, otros 6 Estados miembros presentaron credenciales. No ha sido posible sostener otra reunión con los miembros de la mesa de la 72 Asamblea, pero de conformidad con la práctica seguida durante las reuniones ordinarias, el presidente de la 72 Asamblea examinó las credenciales de estos 6 Estados miembros y consideró que se encuentran conforme al reglamento de la Asamblea. Por consiguiente, recomiendo también a la Asamblea que se acepte que los 6 Estados miembros mencionados presentaron credenciales de conformidad con el reglamento. Quiero mencionar también que en las últimas horas los siguientes Estados miembros presentaron credenciales que han sido consideradas conformes con el reglamento de la Asamblea de la Salud. Estos estados son Comoras, República Centroafricana, República Democrática del Congo y Gambia. Por lo tanto, recomiendo a la Asamblea que Comoras, República Centroafricana, República Democrática del Congo y Gambia sean aceptados por haber presentado credenciales de conformidad con el reglamento de la Asamblea de la Salud. Por último, señora presidenta, informo a esta Asamblea que los siguientes Estados miembros no presentaron credenciales y, por lo tanto, no estarán representados en esta Asamblea: Guinea-Bissau, Niue, Samoa y Sudán del Sur. Con esto concluyo mi informe. Muchas gracias.
My apologies. Thank you, Her Excellency. May I take it that the Assembly agrees to Her Excellency's report? In this age of technology, I see no objections. It is so decided. The list of member states having submitted valid credentials will shortly be available in the journal. Dear delegates, we now turn to the important matter of our agenda. This is item 1.4. You will see that we have before us 3 documents. They are the Provisional Agenda, document A73/1, the Provisional Agenda Abridged, which is document A73/1, add 1, and a proposal for a supplementary agenda item entitled Inviting Taiwan to Participate in the World Health Assembly as an Observer. This is contained in document A73/1, add 2. Regarding this matter, I would like to propose the following. I would propose that we adopt our agendas, both the abridged and the provisional agenda, on the understanding that we shall consider the request for the supplementary agenda item at the resumed session of the Assembly. Further, consideration of the request for this supplementary item at the resumed session would be done in accordance with the relevant rules of procedure. By this, I mean that at the resumed session, the proposal for the supplementary agenda item would, in accordance with Rule 12 of the Rules of Procedure, first be considered by the General Committee. Then, the General Committee would make a recommendation to the plenary on whether or not to include the proposed supplementary item on the agenda. The recommendation would then be considered by the plenary. I note that we hope that the resumed session of the Assembly will be actual and not virtual. But in the event that the resumed session is virtual, we would find a virtual way to follow this arrangement, convening the General Committee in virtual session. This proposal of mine to the plenary is based on my understanding of the outcome of informal consultations among concerned parties, including, of course, the 14 member states who submitted the request for the supplementary agenda item, and my understanding that there is general support for my proposal way forward. In this connection, please also allow me to express appreciation for the goodwill of all concerned in respect of this matter. May I therefore take it that there is no objection to my proposal as I have just set out? I see no objection. It is so decided. Thank you for this decision. Accordingly, the agendas are hereby adopted, and the proposal for a supplementary item shall be considered at the resumed session in accordance with the relevant rules of procedure. We have now completed our work under Agenda Item 1.4. Before turning to the next item, I would like to recognize the statements provided during the opening and recognizing the important relevance of these to the discussion on COVID-19 pandemic, and propose that they be added to the official records of the meeting. May I take it that the Assembly agrees with this proposal? I see no objections. It is so decided. Croatia? I understand that Croatia would like to take the floor. Croatia, you have the floor.
Yes. Thank you, Chair. The European Union works closely with the World Health Organization on a wide range of subjects, both within the European region and on a global level. As agreed in the exchange of letters of 2000 between the WHO and the European Commission concerning the consolidation and intensification of cooperation, and without the prejudice to any future conclusion of a general agreement between the WHO and the European Union, European Union delegation attendance the World Health Assembly as observer. As in previous sessions, we ask the Assembly to kindly agree that the European Union delegation be also invited to attend and participate also in the deliberations of meetings and some committees, drafting groups, or other subdivisions thereof addressing matters failing within Union competence in the 73rd session of the World Health Assembly. Thank you.
May I take it that the Assembly agrees? It is so decided. Now, let us turn to item 3 of the agenda. Address by Dr. Tedros, the Director General.
Thank you. Thank you, Your Excellency. First of all, congratulations on your election, and look forward to support you in any way possible and help this assembly virtual for the first time, which will be a challenge for all of us to go through together. You have made already a very good start, so congratulations on that. I have already spoken earlier, and I believe that I don't want to take more time. So thank you so much again for the opportunity. I will follow the other programs and participate, but I don't think the additional speech will be necessary, and I hope our member state will get a chance also to participate. Thank you.
Thank you, Dr. Tedros. Now we shall turn to the statements of delegations, which will be provided under item 3. And I shall turn the floor over to the Secretariat to manage this aspect of the session. Secretariat, you have the floor.
Thank you, Madam President. We have a number of countries who've inscribed to speak, and we do have regional statements that would precede those national statements. If you permit me, I would indicate those who've asked to make regional statements. We do have Antigua and Barbuda, Estonia, Azerbaijan, Congo, Djibouti, Montenegro, Nauru, the Netherlands, Tunisia. I'll give the floor to Antigua, to be followed by Estonia. It appears we don't have Antigua yet. We would go to Estonia and then to Azerbaijan. Estonia, you have the floor. Okay, we would call on Azerbaijan. Azerbaijan, you have the floor.
Hello, everybody. This is the statement of the Ministry of Health on behalf of the non-aligned movement at the 73rd Assembly. Madam President, Mr. Director General, I have the honor to deliver this statement on behalf of the non-aligned movement. This year, the international community has been faced with a pandemic which has disrupted lives and livelihoods of millions of people, thus creating a state of paralysis in societies and economies. The non-alignment movement expresses its concern at the global threat posed by COVID-19 and emphasizes that the control of the pandemic relies on preparedness, prevention, resilience building, and the greater national, regional, and international collaboration and actions to address this challenge in an effective and timely manner. Upon the initiative of Azerbaijan's NAM chairmanship, the contact group to combat coronavirus was set up, and on May 4th, year 2020, on the online summit of this contact group has been held. In the declaration adopted by summit, the heads of the states and the governments expressed their full support to the WHO while recognizing its critical role, guidance, and leadership in ensuring the effective response of the international community. The summit also established the NAM task force, which will develop a database of humanitarian and medical needs of NAM member states, which will be presented to donor countries and international organizations for the provisions of feasible assistance. During the summit, His Excellency the President of Azerbaijan also announced a donation of another $5 million to WHO to support the most affected NAM member states. The non-alignment movement reiterates its traditional support for multilateralism with the United Nations at its core, expresses full support to UN Secretary General initiatives to fight the pandemic, and acknowledges that preserving and strengthening the values of multilateralism and international cooperation is fundamental to promoting and supporting all three pillars of the United Nations. We also express our strong condemnation at the promulgation and application of unilateral coercive measures against member states of the movement that are applied in violation of the Charter of United Nations and international law. further express our support in accordance with international law to the states affected by such measures and urge the international community to adopt urgent and effective measures to eliminate the use of such measures that are inconsistent with the principles of international law or the chapter of the United Nations, with a view of ensuring the effectiveness of national responses to COVID-19 pandemic. The non-member states express their gratitude to medical personnel and reiterate their readiness to continue collaborating with the WHO in ensuring that one of the fundamental rights of every human being, the enjoyment of highest attainable standards of health, is ensured, that no one is left behind. Global efforts are rightly focused on countering the immediate and devastating impacts of COVID-19. However, going forward, the international community needs to shape a global health agenda that responds effectively to the future pandemics. That would require adequate resourcing and, where appropriate, policy space for the WHO. Equitable access, fair distribution, and affordability of diagnostics, therapeutics, and vaccines for COVID-19 are important priorities for the developing countries, which should be responded to. There is also a need for exploring new instruments to regulate R&D for pharmaceutical products guided primarily by health consideration. The non-member states reiterate their commitments to achieving universal health coverage and health-related sustainable development goals by year 2030 to ensure health security and emergencies, particularly to integrated surveillance, building long-term capacities, and promoting progressive self-reliant strategy based on local production and affordable quality medicines and the development of health technologies. In line with the principle of health for all, the member states call upon the WHO to strengthen their support to governments in their efforts to effectively respond to COVID-19 by providing unhindered assistance and an inclusive and sustained manner during and after the pandemic. In this context, helping the most vulnerable people, including the people under the foreign occupation, including detainees, should enjoy the special attention in line with respect and dignity and leaving no one behind. In conclusion, the non-aligned movement calls upon all states to spare no effort in transforming 2020 into the year of solidarity and renewed multilateral cooperation to effectively address the emerging global threats. Thank you very much. I really appreciate this.
Thank you very much. I will now call on Croatia, who will be speaking on behalf of the European Union and EU member states. You have the floor, Croatia.
Honorable Distinguished Director General, distinguished delegates. I have the honor to speak on behalf of the European Union and its member states. The candidate countries, Montenegro and Albania, the country of the stabilization and association process, and the potential candidate Bosnia and Herzegovina, Ukraine, and the Republic of Moldova, as well as Romania, align themselves with this statement. The global outbreak of the COVID-19 pandemic has challenged the world unprecedented debate and put a heavy toll on people, societies, and economies. Strengthening efficient multilateralism and response is more essential now than ever before. We commend the WHO for its leadership and thank all WHO staff for their tireless and excellent work. We stress the pertinence of coordinated international cooperation and solidarity under the umbrella of the United Nations system, and the crucial importance of measures taken at national level for a successful response to the COVID-19 pandemic. We acknowledge the incredible dedication of all frontline workers were crucial to the COVID-19 response. 2020 is the International Year of the Nurse and the Midwife. Their contribution is indispensable, and we thank them specifically. We recognize the role of immunization in bringing the pandemic to an end, and we consider this is a global public good for health. We ask WHO in close cooperation with other relevant international organizations to play a key role in realizing equitable access to vaccines and treatment against COVID-19 for everybody, wherever they are. We call upon all member states to continue their financial support to WHO in response to the COVID-19 pandemic. Now is also the time to show our solidarity towards the most affected and fragile states, in line with the Agenda 2030 and the principles of leaving no one behind. Our intensified efforts in achieving the SDGs will contribute largely to mitigate the negative effects of the COVID-19 crisis. At the country level, a strong health system and whole of government, all of society, and gender-responsive approach is the key to a successful response. Health systems now need to respond both to the pandemic and to continue to safeguard essential programs and provide essential health services, including for immunization, maternal, newborn, child, adolescent, mental health, trauma prevention, and sexual and reproductive health, in accordance with the 2017 EU Consensus on Development. We have led the coronavirus global response, getting initiative with WHO and global partners to accelerate the development, production, and deployment of vaccines, diagnostics, and therapeutics, and strengthen national health system against COVID-19. We invite all member states to contribute financially to this initiative in favor of funding the HCT Accelerator. I would also like to recall the Team Europe package of 50.6 billion euros, combining EU and EU member states resources to assist third countries for preparedness and response to COVID-19. In this pandemic, threat at microbial requires our attention. The importance of a One Health approach must be incorporated. We need to undertake an independent, comprehensive evaluation of the response to consider all relevant factors to prevent future outbreaks and strengthen preparedness, fully implementing and capitalizing on the IHR, aligning with international priorities. This includes the interface of human and animal health and well-being. The causes and the prevention of zoonotic outbreaks need our special attention, and we would like and we would appreciate a report on this by the Secretary. We thank Member States for their judgment in the negotiation on the resolution that is proposed by the EU and its member states, and the co-sponsors for the consideration of this effort. Now is the time to work together and mitigate crisis. The health of each individual depends. Thank you very much.
Thank you very much, Croatia. I now call on Congo, speaking on behalf of the African region. Congo, you have the floor, please. We do not appear to have Congo online. We will move to Djibouti, speaking on behalf of the group of ambassadors for the Francophonie. Djibouti, you have the floor.
En ces circonstances si particulières, marquées par une crise sanitaire sans précédent, permettez qu'à l'entame de mon propos, je rende hommage à toutes les victimes du Covid-19 dans le monde. Je voudrais également exprimer notre respect et toute notre admiration à l'endroit du personnel soignant où qu'il se trouve dans le monde. Cette crise a ébranlé et continue de mettre sous pression le système de santé du monde entier, y compris les plus performants. Elle nous a montré combien nous sommes vulnérables aux chocs et maladies émergentes et combien finalement nous y sommes si peu préparés. La République de Djibouti, sous les instructions du président de la République, du chef du gouvernement, son Excellence M. Ismaël Omar Guelleh, a très tôt fait le choix d'un dépistage massif et précoce pour identifier au plus vite les cas positifs, tracer leurs contacts, les isoler et les traiter. Des décisions courageuses de fermeture des frontières aériennes et terrestres ont été rapidement prises. Un véritable arsenal de riposte a été déployé pour tester, tracer et traiter les cas. Les sites de quarantaine et de prise en charge ont été rapidement mis en place. Nous avons privilégié une politique de prévention rigoureuse, soutenue par la promotion des mesures barrières et le confinement général de la population. Il faut le souligner, la pandémie de Covid-19 présente à Djibouti un profil particulier, avec près de 90% des cas asymptomatiques ou polysymptomatiques. La réponse proactive et intensive menée depuis le début de cette crise a contribué à atténuer les impacts de cette pandémie. Ce tableau a encouragé mon gouvernement à entamer une profonde réflexion pour sortir du confinement imposé de façon graduelle et progressive. Ce déconfinement se soumettra à des mesures encore plus drastiques de vigilance, prévention et de contrôle de l'infection. Toutefois, mon pays a payé un lourd tribut, en particulier dans le domaine socio-économique. Il s'agira maintenant de sauvegarder les acquis et redoubler d'efforts vers un développement durable. La couverture sanitaire universelle n'aura jamais autant pris sens. Plus que jamais, l'heure est à la mise en place de systèmes de santé résilients, à même de surmonter des crises d'une telle ampleur. Avant de clore mon propos, je voudrais, au nom du gouvernement, saluer le leadership de l'Organisation mondiale de la santé et les efforts considérables menés dans le cadre de cette lutte contre cette pandémie. Restons unis et solidaires. Je vous remercie.
Thank you very much, Ambassador. Could I ask Estonia to take the floor? Estonia on behalf of the Nordic and Baltic states. Estonia, you have the floor, please.
Honorable President, distinguished Director General, distinguished delegates, I'm speaking on behalf of the Nordic and Baltic countries, Denmark, Estonia, Finland, Iceland, Latvia, Lithuania, Norway and Sweden. The Nordic and Baltic countries would like to express our gratitude and full support to the World Health Organization in leading the global health response in this crisis, which is challenging our health systems, societies and economies. The COVID-19 crisis has demonstrated how crucial multilateral cooperation is to our collective health, prosperity and security. Now more than ever, we need to act together as a global community and leave no one behind. In particular, global coordination is needed when it comes to the availability of new vaccines, diagnostics and treatments. We call on global solidarity and a global agreement among all actors to secure equitable and fair distribution once they become available. The pandemic has both We must take action to counter these ill effects of the pandemic. We call on governments to make measures to protect the vulnerable, to increase supportive frameworks and social protection. Further, we would like to emphasize the importance of addressing the gendered impacts of the COVID-19 pandemic. The health, social, and economic consequences have a disproportionate effect on women and girls. Women constitute up to 70% of frontline health workers and are facing an increased risk of exposure to the virus, while access to essential health services, including sexual and reproductive health rights, is limited during the crisis. Evidence shows that there is an increase in maternal and child mortality and violence against women. At the same time, the disease has been particularly serious in older men, and they make up a large percentage of mortality. We therefore encourage all countries to apply a gender lens in their COVID-19 response and recovery plans. The escalation of COVID-19 cases in conflict areas, among refugees, migrants, and other vulnerable people in countries with weak health systems is a real concern and might have a detrimental impact on global well-being and stability. We very much welcome the United Nations consolidated appeal as part of COVID-19 Global Humanitarian Response Plan and highly valued work of World Health Organization and all the health and humanitarian workers in the front line. Finally, we support an independent and comprehensive evaluation of the international health response to the current pandemic. It would facilitate an effective, accountable, and impartial review of the response with a view to strengthen the global preparedness in the future. There are certainly many lessons to be learned. This evaluation should, however, not divert our attention from the current efforts at the global level to put an end to the ongoing pandemic. The right to health is a fundamental human right. The commitment of World Health Organization and the member states to achieving the Sustainable Development Goals and leaving no one behind should be our guiding light going forward. Thank you.
Thank you, Estonia. I shall now call on Nauru to make a statement on behalf of the Pacific Island countries. Nauru, you have the floor, please. Nauru, you have the floor. Very well. We don't seem to have Nauru. May I kindly invite the Netherlands to make a statement on behalf of the Global Health Agenda Group, to be followed by Tunisia. Netherlands, you have the floor, please.
Dear Director General, distinguished colleagues, ladies and gentlemen, thank you for the opportunity to speak to you on behalf of the Kingdom of the Netherlands. We align ourselves with the statement made by Croatia on behalf of the European Union. We express our support and appreciation for the World Health Organization. Now, more than ever, effective international cooperation on global health issues embedded in strong multilateral response and global solidarity is crucial. The current collaboration between global health partners is an inspiring example, and community engagement is essential. Development of effective and safe vaccines, diagnostics and therapeutics is urgent. Public and private sectors across the globe have to step up their joint efforts. Once available, we will need to facilitate equitable access. Therefore, we welcome the patent pool initiative of Costa Rica and the WHO. Strengthening the implementation of the international health regulations and of health systems remain of vital importance. The Netherlands is promoting this as a chair of the Global Health Security Agenda Initiative. The COVID-19 crisis is a serious wake-up call that universal health coverage is not a nice-to-have, but a need-to-have. I would like to echo the words of Director General Tedros. No one is safe until everyone is safe. Meanwhile, we should not lose sight of pre-existing crises and ensure that essential services and activities continue, in particular of WASH, mental health and psychosocial support and sexual and reproductive health and rights. the World Health Organization, all staff and frontline workers can continue to count on our support, and we thank you again for your impressive efforts. Thank you.
Thank you very much. The Netherlands, I now call on Tunisia to be followed by Antigua. Tunisia, you have the floor, please, on behalf of the Eastern Mediterranean region.
السيد رئيس الدورة الثالثة والسبعين للجمعية العالمية للصحة، أصحاب المعالي وزراء الصحة، حضرات السيدات والسادات، إنه من دواعي فخري أن نشارككم أشغال هذه الدورة، والعالم يشهد جائحة كورونا التي مست الكثير من الدول الصديقة والشقيقة والتي نبدي تضامننا تجاهها. وأود أن أشكر الدكتور تيدروس أدانوم غيبرييسوس على كل ما بذله من جهد لقيادة المنظمة حتى تكون في خدمة الشعوب في مواجهتها لهذه الجائحة. وأشكر كذلك الدكتور أحمد بن سالم المنظري مدير المكتب الإقليمي لمنظمة الصحة العالمية للشرق المتوسط لمساهمته الجادة في مكافحة هذا الوباء على المستوى الإقليمي. لقد تمكنت بلادنا من فضل خطة استراتيجية لمواجهة الكورونا قادتها الدولة وشارك فيها المجتمع المدني والكثير من المتدخلين من أن تحد من انتشار هذا الوباء. وقد سجلنا أول حالة يوم 2 مارس 2020 وتدرجت الوضعية رويدا حتى أصبح اليوم بهذا التاريخ لدينا 1032 حالة وسجلنا 45 حالة وفاة، وهذا ما مكن منظومتنا الصحية من استمرار قدرتها على الاستجابة. السيد الرئيس، زملائي، السادة الحضور، إن الوضع الحالي يجعلنا نستخلص درسا كبيرا، وهو ضرورة الاعتماد على سياسات التوقي والحيطة، وعلى ضرورة الرفع من قدراتنا التنظيمية حتى نتمكن من إدارة هذه الجوائح باقتدار ونحمي الصحة العامة. في الختام أود أن أعبر لكم عن رغبتي في أن تقود منظمة الصحة العالمية مبادرة لضمان عدالة فرص الحصول على المستلزمات الطبية وخاصة خلال الأزمات الصحية العالمية. تمنياتي لدورتنا بالنجاح والتوفيق وشكرا لكم.
Thank you very much, Tunisia. I will now call on Congo to deliver a statement on behalf of the African region. Congo, you have the floor, please. Do we have Congo with us? Okay. Madam President, that concludes for the regional statements. We will move now to national statements, if you permit me. We have Côte d'Ivoire, Singapore, Denmark, United Kingdom, and Argentina. Côte d'Ivoire, you have the floor, please. We will move to Singapore. Singapore, you have the floor, please.
Excellency, Madam President, Director General, chief guests, and colleagues. COVID-19 is the greatest challenge our generation faces. It has infected almost 5 million people worldwide. Our thoughts and prayers are with those who have been infected and their family members. We would also like to express our gratitude towards the healthcare workers who have been taking care of our patients. Each member state faces different challenges and adopts a different strategy to fight the pandemic, but all with the same goal of keeping their people safe. In Singapore, we introduced a set of measures called the circuit breaker measures since 7th of April to suppress community transmission. These measures have shown promising results. The daily number of new community cases averaged about 3 in the past week,
our lowest since mid-March. On the other hand, we are proactively managing the COVID-19 cases in our migrant worker dormitories, and the situation has stabilized. Overall, our case fatality rate remains one of the lowest in the world at 0.08%. As COVID-19 will be with us for some time, perhaps until an effective vaccine is available, we must adjust the way we work and live as we move forward. Singapore, like many countries, are now planning to roll back some of the stringent measures we introduced earlier. We need to preserve people's livelihoods while at the same time continue to protect their lives and well-being. Therefore, we must adopt a cautious approach as we gradually open up and progressively roll back the measures. I hope we can learn from each other and cooperate with one another as we fight the pandemic. This is a challenge that no country can succeed on its own. The COVID-19 resolution sends a strong signal to the world that global solidarity is needed to win this war against the virus. Singapore is a co-sponsor of this important resolution. Even as we focus on the immediate challenges of COVID-19, we must not lose sight of the sustainable development goals that ensure that we leave no one behind. We must continue to support the public health efforts and address these health priorities identified in the SDGs alongside our COVID-19 response plans. Singapore fully agrees with the Director General on this. Now is the time for our unity and cooperation. Singapore greatly appreciates the leadership and expertise of the WHO under Dr. Tedros. We affirm our solidarity with the WHO, fellow member states, and the global community in the fight against COVID-19 and in paving the way forward as we begin to plan for recovery from the pandemic. Thank you.
Thank you, Singapore. I would call on the next 4 countries to deliver their statements: Denmark, United Kingdom of Great Britain and Northern Ireland, Argentina, and the Philippines. You have the floor, Denmark.
Dear delegates, dear Director General, Denmark supports the statement made by Croatia on behalf of the EU and its member states. We are exploring unknown territory in our mutual fight against an invisible enemy. And I would like to thank the WHO and its staff for the tireless efforts in guiding and assisting countries throughout this global crisis. We need you now more than ever. We can only beat the pandemic if we act together in international solidarity and with the UN system in a coordinating leading role. We need to learn from this crisis, and I welcome an independent evaluation with the aim of strengthening global response in the future. For now, we must focus our energy on getting through the crisis, on taking the necessary precautions, on developing and producing vaccines, diagnostics, and treatment accessible to all. COVID-19 has demonstrated the catastrophic potential of communicable diseases and the importance of the availability of effective medicines. In this regard, the crisis also highlights the importance of our effort in relation to AMR. Denmark stands ready to contribute to support the development of concrete One Health solutions. A pandemic also has severe impact on access to health services, including sexual and reproductive health and rights. Evidence shows that during crisis there is an increase in maternal and child deaths, sexual and gender-based violence, and a decrease in family planning services. So let us use this unique situation to accelerate progress, and let us do so together through strong multilateral cooperation. Thank you for your attention.
Thank you, Denmark. We have the United Kingdom of Great Britain and Northern Ireland.
Good afternoon. Today's World Health Assembly is so important because coronavirus does not care about nation states. It is a shared challenge, and we can only defeat this invisible killer through a collective response. And if we work together to fight this common threat, I'd like to thank health and care workers across the world for the important work they're doing on the front line, and to thank the World Health Organization and Dr. Tedros for your work. It is so important that all relevant administrations are included in this forum, so discussions on global health security benefit from their valuable experience and expertise. Of course, as with any emergency, there will be lessons to learn from coronavirus, not only for the World Health Organization, but for the wider international system and for all member states. And so we support the need for a review of the global response at the appropriate point. As the international health regulations set out, we all have a collective responsibility here. But for now, we must all remain focused on the fight against the virus. And of course, a vaccine will be our best weapon in this fight. I'm proud that the UK is leading this work, that we're the biggest donor to the global effort to find a vaccine, and that UK research efforts are leading the way. To build on this, the UK will be hosting a global vaccine summit on 4th of June. This will be an important event. Not only do we want to boost efforts to develop a coronavirus vaccine, but we also want to raise the funds so Gavi can immunise 300 million more children and save up to 8 million lives from preventable diseases. I hope that you'll be able to lend your support, because ultimately we are all on the same side in this battle, and it is in all of our interests to succeed.
Thank you very much, United Kingdom. And I call on Argentina to be followed by the Philippines. Argentina, you have the floor.
Muchas gracias, señor presidente. Como ha expresado nuestro presidente Alberto Fernández, nadie se salva solo. Somos conscientes del daño socioeconómico que estamos atravesando a nivel global y por eso debemos continuar trabajando bajo un enfoque integral, implementando medidas que nos permitan mitigar los efectos negativos en la comunidad, poniendo en primer lugar la protección de la vida de las personas. Con objeto de trabajar en forma multisectorial, Argentina creó la Unidad de Coordinación General del Plan Integral para la Prevención de Eventos de Salud Pública de Importancia Internacional, coordinando por el jefe de gabinetes y liderado por el Ministerio de Salud. En este marco se implementaron de forma temprana medidas sanitarias, sociales y económicas destinadas a mitigar la propagación y el impacto del nuevo coronavirus. El 22 de enero, un mes y medio antes de nuestro primer caso, Argentina emitió la alerta epidemiológica y unos días después comenzó a supervisar el ingreso de pasajeros y a recomendar el aislamiento de viajeros que arribaban de zonas afectadas. Al menos 10 días antes de la detección del primer caso, decretamos el cierre de las fronteras, el autoaislamiento preventivo, el teletrabajo, la suspensión de las clases en todos los niveles y la cancelación de espectáculos públicos, entre otras medidas. A los 14 días se estableció el aislamiento social preventivo y obligatorio en todo el país, que aún está vigente. Desde el Ministerio de Salud se trabajó en coordinación con todas las provincias en el fortalecimiento de las capacidades de prevención, detección y respuesta del sistema sanitario. En 45 días se incorporaron 21.850 nuevas camas, 1.452 de ellas de unidades de cuidados intensivos, 5.466 camas generales y 19.907 camas de aislamiento, 1.181 respiradores, 200 ecógrafos portátiles, 12 hospitales modulares y 4.000 profesionales de la salud. Además, se creó un Fondo Nacional de Equidad para asegurar la cobertura integral a toda la población. Se trabajó junto al Ministerio de Producción en el fortalecimiento de la producción nacional de insumos críticos, logrando duplicar la capacidad de producción de respiradores mecánicos y reconvirtiendo una parte de la industria textil para producir equipos de protección personal. Con el objetivo de fortalecer las capacidades de desarrollo tecnológico, recursos humanos y equipamiento de diagnóstico e investigación, se creó la unidad coronavirus, a través de la cual se promueven 3 importantes desarrollos nacionales. La utilización de saliva como muestrea en reemplazo de los hisopos, un test serológico que permite cuantificar los anticuerpos y la autorización de plasma de personas convalecientes como tratamiento. Además, Argentina fue invitada a participar en el estudio múltiple Solidarity de la OMS. Argentina manifiesta su interés en avanzar y apoyar toda iniciativa regional y global destinada a fortalecer las acciones del combate a la pandemia y todas aquellas que permitan el acceso a los resultados de las investigaciones en tratamientos, vacunas y productos médicos. Es necesario que los estados puedan impulsar acciones que garanticen el acceso al conocimiento de estos bienes públicos globales a través de licencias gratuitas o suficientemente accesibles para todas las sociedades del mundo. Esta batalla se gana con el compromiso de cada ciudadano. No es solo una tarea de los gobiernos, es una responsabilidad colectiva. Estamos convencidos que en toda medida que se tome a nivel nacional debe ser coordinada con el ámbito internacional. Poder sortear esta crisis y enfrentarnos a este nuevo mundo nos exige diseñar y suscribir un gran pacto de solidaridad global. Muchas gracias.
Thank you, Argentina. May I now invite the Philippines to follow by Belgium and Kenya. Philippines, you have the floor, please.
Health Assembly President, Director General, Dr. Tedros Adhanom Ghebreyesus, fellow ministers, honorable delegates. The Philippines responded to the COVID-19 pandemic with a whole-of-government and whole-of-society approach, emphasizing quick response, resource management, and strategic communication. To guarantee health system resiliency on the road to national recovery, the Philippines is ramping up the country's testing capacity with increased licensed testing and mega-swabbing centers, clearly defining patient pathways for both COVID-19 and non-COVID-19 patients through province and citywide community-managed healthcare provider networks, defining the guidelines for mass repatriation and quarantine for migrant Filipinos, developing guidelines on non-pharmaceutical interventions as we transition to the new normal. We commend Dr. Tedros for his leadership and thank the WHO for being the primary external support for the public health and clinical management of the pandemic and for emphasizing the UN framework for socio-economic response to COVID-19. We are participating in WHO Solidarity Trial using 4 treatment regimens. Looking at the future, we call on the WHO to put a spotlight on the global code of practice on the recruitment of migrant health workers in a pandemic. Universal healthcare in countries of origin, transit, and destination should not leave behind the migrant populations. We also call for sustained support for the WHO Health Emergencies Program to help countries with weaker health systems. And lastly, the Philippines appeals to the WHO to facilitate regional and global solutions in the procurement of PPEs, testing kits, and medical equipment in view of the global shortage. Fellow member states, as we fight the pandemic, you have our firm commitment to stand shoulder to shoulder with you in working for a safer and healthier world. Thank you.
Thank you, Philippines. May I now invite Belgium to be followed by Kenya. Belgium, you have the floor.
Chair, colleagues, Director General, let me start by expressing my personal gratitude to healthcare workers across the world for their dedication during challenging times. So, Chair, Belgium fully aligned to the statement made by Croatia on behalf of the European Union and its member states. We need three essential instruments in the fight against COVID-19: a whole of government approach, effective health systems, and diagnostic therapeutics, vaccines, and other medical equipment. So the World Health Organization plays an essential role in the management of all three of these instruments. Therefore, I explicitly express my support to the WHO and its leadership. So allow me to make a few remarks, colleagues. First, a reliable and coherent monitoring of the pandemic is key. Belgium decided to report death from confirmed COVID patients, but also the suspected cases. Although WHO recommended this approach, we note that we are one of the very few countries to do so. Unless we all register data in a uniform way, and effective monitoring is impossible. Secondly, in search of a treatment and a vaccine, we need international cooperation, coordination, and also solidarity. We count on the WHO to help us create instruments to assure the equitable access to a possible vaccine. Belgium has a strong tradition regarding the development of new treatments and vaccines. We recently allocated 5 billion euros to CIPI for research and decided to invest 20 million euros in an academic anti-infection unit, a Belgian vaccinopolis, to quickly test and evaluate the efficacy of vaccines on humans. Belgium is ready to show its international solidarity by making ICU beds available for humanitarian personnel in his hospitals. To end, I would like to stress the importance of accessible primary care health service. In order to mitigate the collateral damage of this crisis, we should avoid interruptions in essential initiatives on vaccination, sexual and reproductive health, HIV/AIDS, TB, malaria, and neglected tropical diseases. I thank you for your attention.
Thank you, Belgium. I will now invite Kenya to be followed by Côte d'Ivoire and then France. Kenya, you have the floor, please.
To address this historic
Honorable Minister, I'm afraid we cannot hear you. We'll come back to Kenya when we have sound quality.
Can you hear me now?
We can now. Please proceed, Honorable Minister.
I'm delighted to address the virtual 73rd World Health Assembly, the first of its kind since the establishment of World Health Organization. On behalf of the government of the Republic of Kenya, I wish to reaffirm our commitment to WHO and its leadership, led by Dr. Tedros, as it spearheads multilateral efforts in the response to COVID-19 pandemic. Kenya reported its first case of COVID-19 on March 13, 2020. As part of its preparedness, President Uhuru Kenyatta issued an executive order on February 28, establishing the National Emergency Response Committee on COVID-19. Since then, we have put in place economic, social, and public health measures aimed at interrupting the transmission of the virus within and beyond our geographic borders. Madam President, Kenya is making significant and steady progress towards flattening the curve. We have learned many lessons along the way and continue to apply mitigating measures day by day. Planning for the current situation as well as COVID-19, we aim to build greater resilience in our health systems through increased investments in primary healthcare and health commodity security as critical pillars towards
achievement of universal health coverage. Lessons learned from this crisis has reaffirmed the need for regional, global, and multilateral solidarity and cooperation. We now know that no nation can succeed in isolation. We are particularly encouraged by the demonstrations of unity and humanity shown both within countries and application of information. We thank all those who continue to support and collaborate with Kenya. Kenya therefore joins efforts aimed at ensuring universal, timely, and equitable access to COVID-19 tools as global public good for health. There is urgent need for the business community, including the pharmaceutical industry, to pay the profit motive and support the response to this pandemic. Otherwise, should we continue to behave normally, the pandemic will treat us abnormally. Recognizing that 2020 is the year of nurses and midwives, Kenya appreciates the critical role played by nurses and midwives in frontline health during this pandemic. Fortunately for us, so far, Kenya has not lost any worker to the disease. Let us all work together to end this pandemic. We march together, leaving no one behind. I thank you.
I thank you, Kenya. I will now invite Côte d'Ivoire to be followed by France and then Bahamas. Côte d'Ivoire, you have the floor, please. Okay. We don't seem to have Côte d'Ivoire yet again. We would go to France to be followed by Bahamas and then South Africa. France, you have the floor, please.
Madame la Présidente, Mesdames et Messieurs les chefs d'État et de gouvernement, Mesdames, Messieurs en vos grades et qualités, chers collègues, à l'heure où tous les continents sont touchés par la pandémie de Covid-19 et où de nombreux gouvernements, grâce aux efforts de soignants héroïques et d'une société civile engagée, œuvrent à protéger leurs citoyens de cette crise mondiale, je me félicite que la 73e Assemblée mondiale de la santé puisse se tenir aujourd'hui. Je m'associe à la déclaration prononcée par la Croatie au nom de l'Union européenne et de ses États membres. Face à l'ampleur des défis sanitaires, mais aussi sociaux, économiques, auxquels nous sommes tous confrontés simultanément, il apparaît crucial de rappeler combien le multilatéralisme est aujourd'hui essentiel dans tous les domaines et encore plus dans celui de la santé. À cette occasion, je tiens à rappeler le plein soutien de la France à l'Organisation mondiale de la santé, à son rôle central dans la coordination de la coopération sanitaire internationale. La solidarité internationale nous a permis, nous permet et nous permettra, j'en suis convaincu, d'améliorer notre réponse sanitaire à cette pandémie. Aussi, j'encourage chacune et chacun à poursuivre cet élan sans précédent de mise en commun de nos connaissances et de nos ressources pour avancer ensemble et pour tous selon une approche une seule santé. Je salue les efforts des organisations internationales déjà impliquées ainsi que des initiatives déjà lancées telles que l'initiative ACT qui doit permettre de garantir l'accès de tous aux outils nécessaires pour vaincre le Covid-19. À cette occasion, je me félicite des actions menées par l'Union européenne, tant au niveau régional qu'international. À plus long terme, il est évident qu'il nous faudra poursuivre sur la base de ces acquis notre coopération internationale pour rendre nos systèmes de santé encore plus adaptés à nos besoins de santé, plus résilients face aux crises sanitaires, plus justes face aux inégalités de santé. Dans ce contexte, et conformément au mandat qui lui a été donné depuis sa création, l'OMS aura un rôle majeur à jouer pour fédérer la communauté internationale et promouvoir la santé de nos populations. L'universalité de l'accès à la santé, la qualité et la sécurité des soins et l'adoption d'une approche inclusive de la santé mondiale sont essentielles pour la France. Mesdames, Messieurs, à la lumière de la crise que nous traversons, nous partageons une responsabilité collective. Aucune région ne peut gagner seule la bataille contre le Covid-19. La solidarité entre les pays est plus que jamais indispensable pour préserver nos biens communs. La santé est l'un d'entre eux. Aujourd'hui, sans nul doute, l'un des plus essentiels, mais aussi, nous le voyons, l'un des plus fragiles. Je vous remercie.
Thank you very much, France. I understand we have the Honorable Prime Minister of Bahamas who would like to take the floor. Prime Minister, you're most welcome. You have the floor.
Mr. President, Director General, and distinguished colleagues, today we must embrace the challenges of COVID-19 and the opportunities it presents in terms of healthcare and social care and stability. We must chart a new course. We must acknowledge the new realities that are upon us as we develop and adopt innovative and relevant technologies to manage our societies and daily activities. The Bahamas wishes to bring to your attention the health challenges we continue to overcome and the dire economic situation that is upon us as a primarily tourism-based economy. At least 50% of our GDP is derived from tourism, which employs directly or indirectly up to 60% of the working population. Last September, we experienced Hurricane Dorian, one of the most powerful hurricanes in the Atlantic in recorded history, which ravaged our second and third most populous islands and economic centers. Now, COVID-19 has closed our borders and destroyed our tourism-dependent economy. Economic recovery is halted, even as we prepare for the impending hurricane season in our region, which begins on June 1st and extends to November 30th. The twin unprecedented events of Hurricane Dorian and the COVID-19 pandemic threaten to destabilize our health response and our public health gains. The Bahamas is a far-flung archipelago with many rural areas requiring us to replicate basic health care and social services in a geographic area which extends from South Florida in the United States to the tip of northern Cuba. These two seismic events threaten to widen inequalities and increase the burden of non-communicable disease. We benefited greatly from the application of WHO tools, particularly when testing capacity was limited. We support the draft resolution that addresses timely access to quality, safe, affordable, and efficacious diagnostic, therapeutic, medicines, and vaccines. We thank our partners who donated personal protective equipment and medical devices, training materials, and technical support. I wish to reiterate what I noted at the UN General Assembly last year, soon after Hurricane Dorian devastated two of our major islands. For many years, the Bahamas and countries with similar characteristics have urged an alternative to per capita gross national income as the sole indicator of a country's level of development and eligibility for concessionary financing. I also noted in my 2018 address to the General Assembly, we remain concerned and disappointed that the use of the distorted matrix of GDP per capita as a measurement of national wealth and viability causes the Bahamas to be assessed more favorably than it should be for contributions to international organizations and for the receipt of grants and international assistance when disaster strikes. In this vein, as we request assistance to address COVID-19 in the Bahamas and in other small island states, we urge the international community to adopt and to appreciate a broader understanding of the developmental levels and the unique local circumstances in our states. Thank you and good afternoon.
Thank you very much, Most Honorable Prime Minister. We will now invite South Africa to make their statement, followed by Algeria and then Poland. South Africa, you have the floor, please.
Thank you. Thank you, President.
Please proceed, South Africa. South Africa, you may proceed with your statement, Honorable Minister. Thank you.
Thank you very much, Mr. President, Your Excellencies, the Director General, Mr. Tedros, and other ministers. South Africa joins the international community to respond with agency to the scourge and devastating COVID-19 and to collectively loss of the many lives that have been lost from the virus. As a country, we have not been spared by COVID-19. In fact, we are amongst those countries that are reporting the highest number of cases on the African continent. We have managed to keep our case fatality at approximately 1.9%. As of the 17th of May 2020, cumulatively we have 413,000 people with 14,000 positive cases and 261 deaths. The key objective of our COVID-19 response strategy has been to slow down the infection rate through several interventions. By delaying the spread of the disease, we've been able to strengthen the capacity of our health system and put in place wide-ranging public health programs to better manage the increase in the infections. Using the valuable time with the lockdown gave us, we have managed to significantly expand our testing and testing. In all, our members have now treated over 10 million people. We have referred 32,000 for further testing. Our strategic approach is based on saving the lives and preserving livelihood. Like other countries, we are also experiencing challenges the following, such as the limited production, distribution, testing, and extraction by international suppliers. Personal protection in the form of masks, body suits remain a challenge, and balancing the need to save the lives and the economy, and our people are also not destitute. From the very beginning, our response has been guided by the advice from the world experts and from our country and across the world. We must take the opportunity to appreciate the guidance of the technical experts, WHO, further commend the leadership of the WHO, in particular Dr. Tedros, in these difficult times for the entire globe. As South Africa, we are pleased to be participating in the Solidarity Trail and look forward to using our franchise to also conduct research on markets. We wish to highlight His Excellency as the current chair of the joined the global people's vaccine statement, which emphasized that the vaccine should be available to on the basis of need and ability to pay when the vaccine was produced. This is the real essence of universal health coverage at a global level, an example of real global solidarity. We, as other nations, tested to the fullest from this pandemic, both from the health system perspective. We have, however, become stronger and wiser. If we will collectively rise again as a nation, a family of nations across the globe, and will overcome these things. I wish to therefore thank you, Mr. President.
Thank you very much, Honorable Minister. I'm advised that we have now Congo, who is ready to make a statement on behalf of the African region, and we did play the video of Tunisia in their national capacity rather than in the regional statement that they had been also ready to present. So I'll call on Poland, and then I'll give the floor to Congo, to be followed by Tunisia. Poland, you have the floor, please.
Honorable Chair, distinguished Dr. Tedros, colleagues, Poland fully aligns itself with the statement delivered by Croatia on behalf of the EU and its member states. The world is facing a challenge that we must respond to in a spirit of solidarity and cooperation. A lot has already been done, but yet there is still much to do. To start with, I would like to thank WHO for its leading role and coordination in the global COVID-19 pandemic's response. We also express our deepest appreciation for the work and dedication of medical staff around the world. In this difficult time, you stood up to the challenge. Poland participates in the global efforts to combat the pandemics. We take part in the WHO Solidarity Trial. We have also sent our medical teams to other countries to support their fight against COVID-19. Moreover, Polish government has pledged funds contributing to ACT Accelerator. Last but not least, a drug produced by a Polish pharmaceutical company is registered as an element of supportive therapy for coronavirus infections. The global goal for the coming future is to find an effective drug and vaccine against COVID-19. We must make sure that both the drug and the vaccine will be equally accessible and affordable so that no one is left behind. Transition phase is ahead of us. We need to plan it very consciously and carefully to respond to the challenges ahead of us in the best possible manner. We are witnessing history, but we are also the ones who make it. Only by uniting our efforts we can combat COVID-19 pandemics. We declare our full commitment in the fight against the new coronavirus, and we ask the whole international community to unite its efforts in the spirit of solidarity and trust. Thank you.
Thank you very much, Honorable Minister. I will now invite the Minister of Health for Congo to speak on behalf of the African region. Madam, you have the floor. Honorable Minister from Congo, you have the floor. Okay. I would move to the regional statement on behalf of the Eastern Mediterranean. I understand Congo is back. Honorable Minister, you have the floor, please.
Madame la Présidente de la 65e session de l'Organisation mondiale de la Santé, Mesdames et Messieurs les ministres de la Santé, Monsieur le Directeur général de l'Organisation mondiale de la Santé, distingués participants, la République du Congo a l'honneur de faire cette déclaration au nom des États africains, membres de l'Organisation mondiale de la Santé, à l'occasion de la 73e Assemblée mondiale de la Santé qui se tient pour la première fois dans des conditions particulières imposées par la pandémie de Covid-19. Depuis plusieurs mois, tous les continents sont confrontés à cette maladie qui a gravement bouleversé notre mode de vie et soumis à rude épreuve la résilience du système de santé ainsi que les efforts du personnel de santé de nos pays respectifs. C'est ici l'occasion pour les États africains de remercier l'Organisation mondiale de la santé pour son leadership dans la riposte à cette pandémie. Féliciter et rendre un grand hommage à tout le personnel de santé de tous les pays pour leur inlassable effort aux côtés des patients et s'incliner devant la mémoire de toutes les personnes décédées à travers le monde de cette maladie. Madame la Présidente, la pandémie Covid-19 constitue une grave menace pour notre continent. Elle vient malheureusement ajouter aux multiples défis auxquels nos pays restent confrontés depuis des décennies. Dans le contexte de la riposte au Covid-19, les pays africains rappellent qu'il est impératif que des actions concertées soient entreprises au niveau national, régional et international pour combattre efficacement cette pandémie. Il est donc nécessaire de mettre l'accent sur la coopération, la coordination et la communication. C'est dans cet élan que le continent africain a mis en place un groupe de travail d'experts du CDC, un groupe de travail africain sur le coronavirus AFCOR et un comité de coordination au niveau ministériel. Il a aussi créé le Fonds de réponse Covid-19 de l'Union africaine. Nous saluons toutes les initiatives prises par le président en exercice de l'Union africaine à cet effet. Madame la Présidente, notre stratégie commune sur le Covid-19 met l'accent sur 3 piliers essentiels. Réduire la transmission, limiter les décès, réduire ou limiter les effets socio-économiques et culturels. Le Centre africain de contrôle et de prévention des maladies, CICI Afrique, avec ses centres de collaboration régionaux, continue de soutenir les États membres de l'Union africaine dans leur activité de préparation et d'intervention. Nous comptons également sur le soutien de l'Organisation mondiale de la santé et de tous les autres partenaires, y compris les secteurs publics et privés. Madame la Présidente, les États africains, en collaboration avec l'OMS, ne se détournent pas de l'objectif de fournir des soins de santé primaire pour tous. La riposte au Covid-19 doit nous rappeler qu'il est essentiel de renforcer les soins de santé primaire et de les placer au cœur des efforts d'amélioration de la santé et du bien-être pour tous. L'Organisation mondiale de la santé est encouragée à aider continuellement les pays à renforcer la résilience de leur système de santé si nous voulons atteindre les objectifs de développement durable à l'horizon 2030. Dans le même ordre, bien qu'il reste encore beaucoup à faire, les pays africains réitèrent l'objectif santé pour tous et appellent au renforcement des moyens de diagnostic, à la facilitation des approvisionnements en matériel et réactifs et des efforts mondiaux en matière de vaccination, de la prévention en général et de la promotion de la santé. L'appui de l'OMS dans la recherche de solutions en vue d'annuler la dette des pays africains est vivement souhaité. En effet, la situation socio-économique et sanitaire actuelle de l'Afrique, accentuée par la pandémie de Covid-19, appelle une fois encore l'OMS à clarifier si les produits finaux issus des recherches en cours sur le Covid-19 seront rendus disponibles dans le domaine public, où ils seront protégés par les brevets et autres droits de propriété intellectuelle. Aussi, si l'OMS militera pour le développement de produits par l'usage des flexibilités et le partage des technologies. Les pays africains seront favorables à toute démarche relative à l'effet de promouvoir les droits des États membres de l'OMS à l'accès aux médicaments pour tous, ainsi qu'aux technologies nouvelles. Madame la Présidente, avant de clore mon propos au nom des ministres de la Santé des pays africains, je tiens à réitérer notre soutien au Dr Tedros et à la Direction générale de l'Organisation mondiale de la santé dans la recherche de solutions aux problèmes de santé publique à travers le monde. On vous remercie.
Thank you very much, Honorable Minister. May I now invite the Minister of Health for Tunisia to make a statement on behalf of the Eastern Mediterranean region. Honorable Minister, you have the floor. Thank you.
السيد المدير العام لمنظمة الصحة العالمية، السيد رئيس الدورة 73 لجمعية الصحة العالمية لجمعية الصحة العالمية، السيدات والسادة أصحاب المعالي والسعادة. نتوجه بالشكر والإقليم من الشرق المتوسط للمدير العام لمنظمة الصحة العالمية على ما بذلوه من جهود لدعم الدول الأعضاء قصد التصدي لجائحة الكوفيد 19. إننا نواجه تحديا صحيا عالميا هائلا، وهو ما يتطلب منا جميعا اتخاذ إجراءات منسقة وحاسمة ومبتكرة. ويواجه إقليم المتوسط حداثة طوارئ إنسانية واسعة النطاق يرجع الكثير منها إلى الاحتلال الأجنبي والنزاعات المسلحة. وأضعفت بشدة العديد النظم الصحية في الإقليم، ولذلك بات اتباع نهج يشمل الحكومات بأكملها والمجتمع بأسره أمرا ضروريا لاحتواء انتشار الكوفيد-19، مع التركيز على تعزيز النظم التي لا غنى عنها لتحسين التأهب والاستجابة. ونذكر أن الدول والقيادات الصحية العالمية قطعوا على أنفسهم عهدا غير مسبوق يوم 24 أبريل بالعمل معا لتعجيل باستحداث وإنتاج لقاحات وعلاجات جديدة لفيروس كوفيد-19 ولضمان المسؤوليات في الحصول عليها في جميع أنحاء العالم. وقد سار عمل منظمة إقليمية ومكاتبها الوطنية حال الإبلاغ عن أولى حالات الإصابة بكوفيد-19 على المستوى العالمي، لا تكفي الجهود لمساعدة الدول الأعضاء على التأهب لمواجهة الأثر المحتمل للفيروس في إقليمنا. ونعرب عن الشكر للمدير الإقليمي على المساعدة الفنية والعملياتية والمادية القيمة، وقد تجسدت عبر كيفية تصدي الدول الأعضاء لهذه الجائحة القيم الواردة في رؤية منظمة الصحة العالمية للإقليم رؤية 2030 التي تشدد على التضامن والعمل من أجل الصحة للجميع. وعلى الرغم من الجهود الكبيرة التي بذلت لتطبيق تدابير الصحة العامة اللازمة، لا نزال نواجه تحديات كثيرة، ولا نزال نتعلم المزيد عن هذا الفيروس الجديد. وتمر الدول الأعضاء في الإقليم حاليا بمراحل مختلفة من الوباء، وعلينا أن نستعد لموجات تفشي لاحقة، سواء في البلدان التي تنخفض فيها أعداد الحالات أو في البلدان التي لم تبلغ فيها الجائحة ذروتها بعد. ويجب علينا أن نحمي العاملين في الرعاية الصحية في بلادنا وأن نستثمر فيها. ويجب أن نواصل إشراك مجتمعاتنا المحلية وتعبئتها ودعمها وإبلاغها بالحقائق والمعلومات. ولا بد أن نتأكد من استمرار حصول الناس على الخدمات الصحية الأساسية الأخرى مثل التمويع وتقديم الرعاية الصحية للأمهات والأطفال. ونحث منظمة الصحة العالمية على مواصلة السعي لإيجاد حلول علمية لمرض كوفيد-19، وكذلك تحديد النهج المستدامة التي من شأنها أن تمكن البلدان من تقليل سريان المرض إلى أدنى حد مع السماح بالاستئناف التدريجي للحياة الاقتصادية والاجتماعية استنادا إلى تقييمات دقيقة للمخاطر. كما ندعو إلى مواصلة المنظمة وشركائها العمل مع الحكومات وغيرها من الجهات المعنية للمساعدة على ضمان تدفق الإمدادات الطبية الحيوية وغيرها من السلع والخدمات بين البلدان. ونشيد بالعمل الجاري الذي تقوم به المنظمة وشركائها بخصوص إنشاء نظام مشترك بين الوكالات لسلسلة إمدادات كوفيد-19، لأنه أمر ضروري حتى تتمكن الدول ذات الدخل المنخفض والمتوسط من التصدي بفاعلية لهذه الجائحة وفقا للوائح الصحية الدولية 2005 والقوانين واللوائح الوطنية. ونحث المجتمع الدولي على مواصلة اتباع مبادئ القانون الدولي وميثاق الأمم المتحدة من أجل التمكن من التصدي بفاعلية للكوفيد-19 في جميع البلدان. وأخيرا نشدد على الأهمية البالغة للتعاون العالمي من أجل احتواء الجائحة تعزيزا للحق بالصحة والحياة. ولذلك نجدد الدعوة الصادرة عن الأمين العام للأمم المتحدة والمفوضية السامية للأمم المتحدة لحقوق الإنسان لرفع العقوبات أحادية الجانب التي تعيق الجهود الدولية المشتركة للحد من انتشار الفيروس ومعالجة المرض في البلدان المستهدفة. شكرا لكم على حسن الإصغاء.
Thank you. Please accept our sincere apologies. Okay, we don't seem to have Algeria. We would now proceed to Botswana, to be followed by Zimbabwe, and then Germany. Botswana, you have the floor, please.
Thank you, Chairperson. Botswana note with satisfaction all efforts made by the World Health Organization to control and contain the COVID-19 pandemic, one of the most unprecedented outbreaks, and perhaps by far one of the most sobering public health emergencies the world has experienced in a long time. The assistance provided by WHO to member states in order to strengthen their capacity to prevent, detect, and confirm rapid response to public health risk and save life has no doubt mitigated what could have been a telling catastrophe, particularly for the developing countries. We, however, note with concern some challenges associated with our historic weak health systems, such as inadequate resources and emergency response to public health threats. Other issues relate to financing, incident management systems, public awareness, and community engagements, further compounded by porous borders. We equally note the economic development and social consequences of this outbreak and the constellation of threats to lives and livelihood of our people. Chairperson, there is now need, more than ever, for all member states and development partners to step up health security efforts by reinforcing the development of resilient health systems and improve efforts for prevention, alert, and response to public health emergency. Botswana therefore calls for greater investment in emergency preparedness and research and development to ensure a robust global health risk framework. Following the outbreak in Botswana, His Excellency the President established a multi-sectoral National Public Health Emergency and Preparedness Committee and a National Presidential Task Force to coordinate the response. The main focus of our response is on prevention, preparedness, recovery, and continuity of the health system and the economy. Through our efforts, we have so far tested about 13,000 people, which translates to about 6,000 tests per million. And we've registered 25 COVID-19 positive cases, 17 recoveries, and only 1 death. Chairperson, as Botswana, we reaffirm our support for the WHO and its leading role in the global health governance and public health emergency. I commend the Director General, Dr. Tedros, and his team for a sterling job. In conclusion, I wish to express my appreciation for the frontline workers and support staff the world over for their hard work and sacrifice. We are a resilient species, and we shall overcome. I thank you.
I thank you, Honorable Minister. May I now invite Zimbabwe to be followed by Germany, Fiji, and Malta. Zimbabwe, you have the floor, please.
Accessibility shortcuts, 17 items, voice guide. On.
Honorable Minister from Zimbabwe, you have the floor. Okay, we would move to Germany and then come back to Zimbabwe when we have the feed. Germany, you have the floor, please. I'm afraid we still don't have Germany. We would go to Fiji and then Malta. Fiji, you have the floor, please.
Bulubinak, the Director General of World Health Organization, Dr. Tedros Ghebreyesus, Honorable Ministers and delegations from member states, distinguished excellencies, donor partners, and philanthropists. global WHO technical support teams, ladies and gentlemen, I am indeed honored to address you all today. The COVID-19 global pandemic is no doubt an extraordinary event for all humanity and has brought suffering to countless families and communities across the globe. I take this time on behalf of the government and the people of Fiji to express our deepest and most sincere sympathy to governments and citizens of all nations who have lost loved ones from the COVID-19 pandemic. Fiji's Prime Minister, the Honorable Jose Bainimarama, has been at the forefront of our fight against COVID-19. His firm leadership and the support of Cabinet and the critical government agencies and statutory bodies ensured an efficient decision-making process and the timely implementation of containment strategies that reduce the risk of spread of the disease in the community. Three main drivers that greatly facilitated Fiji's preparedness and response effort were the approval by government for a supplementary COVID-19 budget that provided additional funding to the Health Ministry, the amendment to the Fiji Public Health Act, and the declaration of a state of natural disaster for the COVID-19 disease. The declaration of 2 states of natural disaster, with one being the result of a disease outbreak, is unprecedented in Fiji's history. However, those critical actions enable us to make crucial decisions and implement measures that ensure the protection of public safety, the timely intervention for those who are suspected or confirmed with the disease, and the ultimate recovery for those under our hospital care. Our border control measures were instituted and rapidly escalated as the pandemic continued its global spread. Social or physical distancing measures that were implemented nationally included targeted community lockdowns, night curfews, and the closing of amusement centers like cinemas, liquor bars, nightclubs, gyms, and community swimming pools. Our contact tracing teams that include personnel from health, the military and police force have followed up 100% of all close contacts of the confirmed cases and continue to follow them up to date. WHO assisted our laboratory testing capacity, firstly through the sending of samples to the reference laboratory in Melbourne, Australia, and later with the opening of our own RT-PCR testing facility at the Fiji Center for Disease Control on the 11th of March 2020. As I speak, Fiji has recorded 18 cases of COVID-19, 14 of which have recovered, and 4 are still active, and with an overall recovery rate at the moment at 78%. Fiji has successfully broken the chain of transmission within the community with strong and timely public health measures, and particularly with the early removal of every case and their close contacts into dedicated health facilities with monitored isolation. Fiji experience has shown that a whole-of-government approach is absolutely necessary, with decisive leadership and swift implementation of strategies are critical for lowering mobility and mortality from this pandemic. Fiji has also shown that in the presence of the impact of climate change, the ability of a small island nation to mount an effective response to an outbreak of infectious diseases will require a Herculean effort that will impact greatly on its resources for many years to come. I thank you.
I thank you, Fiji. We understand Zimbabwe is online. We would give the floor to the Honorable Minister of Zimbabwe, and then we'll come to Germany and Malta. Zimbabwe, you have the floor, please. Minister, we are unable to hear you. Could you... Okay, we will try again. Do we have the Honorable Minister of Health for Germany online? Okay, we will move to Malta, to be followed by Thailand. Malta, you have the floor, please. We'll move to Thailand. We'll move to Thailand and then Colombia. Thailand, you have the floor, please.
Mr. President, we are at war against COVID-19. Thailand has hammered down the epidemic and is cautiously moving into the dancing stage. We have learned important lessons. First, we have survived only the first few battles. Before the war is over, we must remain vigilant and should not yet declare victory. Second, this war requires the leadership of the head of state or government to ensure effective multi-sectoral actions. As the battlefield is nationwide, more than 1 million Thai village health volunteers and leaders of local governments have been actively involved. Third, a wide range of mandatory and voluntary measures is needed. Their success requires strong public awareness, engagement, and cooperation. Fourth, although fighting COVID-19 requires political decisions, we must quarantine politicizing COVID-19 to ensure solidarity. Finally, COVID-19 proves the value of long-term investment on universal health coverage and health systems manned by well-trained and committed health workers, especially nurses. Our USC covers all health services of COVID-19 for everyone on Thai soil. We do not and will not leave anyone behind. We do not have other options. We only have to fight, and we will win. Thank you, Mr. President.
Thank you, Honorable Minister. May I now invite Colombia to be followed by Australia and Indonesia. Colombia, you have the floor, please.
Un saludo especial al presidente de la Asamblea, a la mesa directiva, al personal de la OMS y a las demás delegaciones de países asistentes. Queremos agradecer al director general y al personal de la OMS por todo el arduo trabajo realizado durante los últimos meses, brindando asistencia técnica a los países para afrontar la epidemia. La pandemia del COVID-19 ha puesto a prueba todos nuestros sistemas de salud y los sistemas de vigilancia epidemiológica de los diferentes países, requiriendo de grandes esfuerzos técnicos y económicos para poder soportar la epidemia. El periodo de la cuarentena ha permitido igualmente fortalecer los servicios de salud, nuestra capacidad de respuesta, la capacidad de asistencia y la capacidad de tomar acciones para poder desarrollar y proteger a nuestra población frente a la eventualidad y los riesgos de salud. Nosotros, como país, como Colombia, un país de 50 millones de habitantes, hemos retomado diferentes acciones que incluyen el aislamiento de la población mayor de 70 años, la eliminación de las clases por un periodo prolongado de los jardines infantiles y áreas escolares. Igualmente hemos tomado acciones que buscan el distanciamiento físico de las personas como estrategias fundamentales para poder abordar la epidemia. Colombia ha realizado más de 150.000 pruebas al día de hoy. Tenemos una inversión de cerca de 21 billones de pesos en todo lo que tiene que ver con atención, elementos para la atención directa e indirecta a la población afectada por el COVID-19 y estamos en la búsqueda de capacidad y expandir nuestra capacidad de realización de pruebas, nuestra capacidad de atención e igualmente las posibilidades de uso social y comunitario de elementos de protección personal. Colombia como país y como sociedad ha podido desarrollar esquemas solidarios, esquemas de cooperación con los países vecinos para poder igualmente integrar acciones conjuntas y para poder afrontar el riesgo grande que implica la atención integral e implica la protección de nuestros ciudadanos frente a la pandemia. Entonces hacemos un llamado muy especial a todos los países del mundo, a los integrantes de la Organización Panamericana de la Salud, de la Organización Mundial de la Salud, en esta asamblea desarrollar mecanismos de cooperación que nos permitan integrar nuestros esfuerzos, desarrollar conjuntamente protocolos y estrategias para el abordaje de la epidemia y también para el restablecimiento del orden social, cultural y económico de nuestras sociedades.
Thank you very much, Colombia. I will now invite Australia to be followed by Indonesia. Australia, you have the floor.
Australia recognises the suffering many countries are enduring, and we stand in solidarity with our frontline health workers and express our condolences to all the families of COVID-19 victims. Our steps towards suppressing COVID-19 were swift, and we acted decisively, containing our cases to approximately 7,000. As a result, we are now therefore able to carefully ease some restrictions. But no single country or organisation can effectively respond to COVID-19 alone. We therefore thank the EU for its leadership and are proud to co-sponsor the COVID-19 resolution. We are pleased to have support for an impartial, independent and comprehensive evaluation of the global response. We need to learn the lessons from this pandemic and ensure we have the strongest possible global health architecture with an enhanced ability to prevent and respond to future outbreaks. This could include an examination of whether the WHO's mandate and powers, including around inspection, need to be strengthened to ensure WHO members have timely access to critical data, and we need to protect against the global health threat posed by wildlife wet markets. Global efforts also need to prioritise finding a vaccine, and Australian researchers are playing a vital role in this. Australia is providing development assistance in response to the pandemic, and the WHO is an important partner in this effort. Inclusivity has never been more important as we confront the immediate impacts on communities and economies. It is essential that no populations or potential partners are excluded. Australia will continue working with the global community to end this pandemic and strengthen health systems to protect against future pandemics.
Thank you very much, Australia. We will now invite Indonesia, and I understand that Germany is back online now, so we'll go to Germany after Indonesia. Indonesia, you have the floor, please.
Excellencies, at the outset, our appreciation to the WHO for its continued support and effort in coordinating the global COVID-19 response. We extend our sympathy and condolences to all who has been affected. Today, the world come together to fight a common enemy that has impacted gravely the global social and economy to every country. Indonesia joined global effort to continue increasing concerted measures to prevent, detect, and respond COVID-19. In its own part, Indonesia has formulated a series of policies to fight COVID-19 in all aspects of health, social, and economy through whole government and whole society approach. Allow me to stress out the importance for us to deliver a unified and synergized action to end COVID-19 by first, strengthening our political solidarity. Second, ensuring the global supply chain for accessing essential medicine and medical equipment for all countries remain open, and to ensure a mechanism for equitable and timely access to affordable medical and vaccine for COVID-19. Third, supporting the strengthening of the national health capacity of countries in need remain crucial. Multilateralism should remain the platform for international cooperation, and Indonesia commits to support the success of WHO Solidarity Trial and ready to contribute to upscaling production of a new antiviral and vaccine COVID-19 for global need. Thank you.
Thank you very much, Indonesia. Unfortunately, we appear to have lost Germany again, but they'll come back online. Could we try Zimbabwe and then Cote d'Ivoire? Zimbabwe, you have the floor.
Thank you once again, President of the 73rd World Health Assembly, Ambassador and Permanent Representative of the Bahamas, Her Excellency Mrs. Kiva Bain, the Director General of the WHO, Dr. Tedros, distinguished guests. Let me begin by congratulating you, Madam President, and the Bureau on your election to preside over these proceedings. Allow me also to express our sincere condolences to the families who lost loved ones to COVID-19 and our solidarity with all countries. Zimbabwe commends Dr. Tedros, the whole entire WHO staff, and the global health workforce for their hard work. In response to the COVID-19 threat, our President, His Excellency, Comrade Emerson Mnangagwa, declared a state of national disaster on the 17th of March 2020 and announced the postponement of major national events and discouragement of travel to and from high-risk countries. Zimbabwe recorded its first COVID-19 case on 21 March 2020 and introduced a national lockdown on the 30th of March 2020. We have recorded 46 cases, 18 recovered, and lost 4. Going forward, we plan to increase the number of tests per day, but we are hampered by lack of access to test kits and PPE. We have improved our COVID-19 surveillance and contact tracing with a mobile app. And one of our challenges was quickly decentralizing operations to provinces. However, significant progress has been made on that score, and we continue to strengthen our primary healthcare systems. Since February 2020, we have instituted travel restrictions with a 21-day mandatory quarantine for returning residents. We continue to strengthen our public health rapid response teams to conduct case investigation and screening of contacts and high-risk groups. In conclusion, let me express my government's gratitude to the WHO, development partners, and countries that have provided support to our COVID-19 response and our continued strengthening of our routine health service delivery. Thank you.
Thank you very much, Honorable Minister. May I now invite the Minister of Health from Côte d'Ivoire to be followed by Bhutan and then India. Côte d'Ivoire, you have the floor. Honorable Minister, we don't seem to have a sound. We will come back to you when your sound is a bit more audible. Could we now invite the Minister of Health for Bhutan to be followed by India? Thank you. Bhutan, you have the floor.
Thank you. Madam President, Excellencies, Honorable Ministers, and distinguished delegates, first of all, I would like to convey the warmest greetings of His Majesty the King, the Royal Government, and the people of Bhutan to the 73rd World Health Assembly. The world now more than ever has realized the importance of investing in the health for all and health in all agenda. Today, as we convene the 73rd WHA, the world is faced with an unprecedented public health crisis. This global pandemic has reminded us of the critical need to invest in building resilient and sustainable health for all. Excellencies, ladies and gentlemen, we thank the Director General for the efficient leadership and progressive role of the organization in responding and coordinating with the member states and partners in our preparedness and response efforts in combating the current pandemic. Bhutan is pleased to note the global solidarity expressed by member states, and I convey my sincere prayers and goodwill to contain the global outbreak and restore peace and well-being. Excellencies, ladies and gentlemen, Bhutan's response to the COVID-19 pandemic is led by His Majesty the King, who himself is at the front line and continues to lead with compassion and wisdom. Guided by the wisdom of His Majesty, Bhutan's response has been a whole of a society approach to ensure that no individuals and families face any hardship due to the current pandemic. Excellencies, ladies and gentlemen, Bhutan strongly supports that this global pandemic can only be addressed successfully through united and concerted effort of all member states. Therefore, we would like to add our voice to the long list of member states who have expressed their unwavering support to the united resolution to respond to COVID-19. Excellencies, ladies and gentlemen, Bhutan reaffirms our commitment to work collectively towards the benefit of not only the Bhutanese, but also the population around the world. We also wish to send a strong reminder to support and secure safety of our health professionals and other frontline workers who are directly at the forefront battling COVID-19. Lastly, I, on behalf of the government, would like to extend our support and cooperation for a successful deliberation with sincere prayers for good health and happiness for all. Tashidele, and I thank you.
Thank you very much, Bhutan. We would now invite the Honorable Minister for Health for India and to be followed by Malta. India, you have the floor, please.
Her Excellency, Ms. Keva Bain, President of the World Health Organization, Dr. Tedros, Director General of WHO, and Excellencies, at the very outset, I wish to express my deepest condolences at the loss of lives across the world due to COVID-19. I also take this opportunity to express my sincere gratitude for the efforts of those who are in the front line of this battle. We in India undertook the COVID-19 challenge with the highest level of political commitment. Our Honorable Prime Minister, Shri Narendra Modi, personally monitored the situation and ensured a preemptive, proactive, and graded response, leaving no stones unturned to contain the deadly virus from spreading. India took all necessary steps well in time, including surveillance and entry, evacuation of stranded overseas, massive community surveillance through robust disease surveillance network, strengthening of health infrastructure, capacity building of over 2 million frontline human resources, risk communication, and community involvement. I think we did well, and we did well. We are learning and we are confident of doing better in the months to come. Excellency, today there are compelling circumstances that have forced us all to meet virtually. The 73rd World Health Assembly is the first ever virtual health assembly. It is unprecedented, but it's also perhaps the most important one ever. Because as we sit and discuss here, the pandemic continues to kill thousands of people and also causing a deep global recession. This is the time when humankind must come together. Today, I urge upon the governments, industry, and the philanthropy to prioritize the long term and pool their resources to ensure everyone benefits. On our part, India is playing a key role in fostering bilateral and regional partnerships. Under our Prime Minister's able leadership, India has supplied essential medicines to 123 nations as an expression of solidarity. Therapeutics, diagnostics, and vaccines for the whole world is the only way out of the pandemic. Global collaboration is paramount. Governments, industry, and philanthropy must pool resources to pay for the risk, research, manufacturing, and distribution, but with the condition that the rewards should be available to everyone, regardless of where they have been developed. Today, in the two-day deliberations, we should share our learnings from how each one of us has tackled the catastrophe since January. How we can support the financial or technical gaps that some of our member states may have, and agree to continue R&D in an aggressive and collaborative way. In congratulating all those who are striving to save humanity, we welcome efforts to make all international institutions more reflective of 21st century realities. India will always stand with such efforts to foster meaningful and broad-based change. I close my speech today with a loud applause for all those across the world who are in the forefront of this battle against the deadly virus. I stand here to honor the doctors, the nurses, the paramedics, the scientists, the journalists, the delivery boys, security staff, sanitation staff, and the police personnel. The forgotten roles today playing superhuman. They are our real heroes. Many thanks for the opportunity to speak before this gathering.
Thank you, Honorable Minister. May I now invite Malta to be followed by Iran. Malta, you have the floor.
General Director, colleagues, good afternoon. Malta aligns itself with the statement delivered by Cape on behalf of the Council of the European Union. If ever there was a time for nationalism and for solidarity between nations and between regions, now is that time. There is no doubt that each and every one of us in each and every country that we live and work in will be judged, will be scrutinized, we will be audited, and I'm sure in some instances there will be recriminations. And as all of us have to stand to the scrutiny, so does WHO. And yes, there will be a time when WHO's actions, policies during these weeks and months will be scrutinized. But now, in my opinion, is the time for support and the time for closing ranks. And Malta supports WHO in its work over the last 4 months, and we augur that it seems to work with the same zeal and dedication that it has done so far. International solidarity has to happen in practice. The big issue over the next few weeks, months, possibly years, is the production and the availability of vaccines to all and to all citizens in all the world. Lives matter wherever they are in the world. Therefore, it is absolutely essential that there is no part of our global society which is excluded from the availability of vaccines and when they are. And I am sure and I am positive that WHO has an important role to play in this. And Malta will want to support WHO in this. Thank you very much. Keep up your good work.
Thank you, Honorable Minister. May I now invite the Minister of Health for Iran.
For the mobilizing and coordinating our collective battle against the COVID-19 pandemic. The organization truly deserves to be supported, not pressured by any member state. My country has been hit hard by the outbreak. However, we have managed to flatten the curve and reduce the mortality rate drastically due to extensive public health measures taken on the basis of the whole-out state, whole-out society approach. In our ambitious national campaign to curb the virus, more than 78 million people were screened using our strong PHC infrastructure in a stepwise referral system, which resulted in dramatic reduction in hospital admissions. In second round of screening, 22 million high-risk people were targeted. We provided equal care for all based on needs, including elderly, poor, and even refugees. We expanded our laboratory capacities to outpatient clinics, focusing on contact tracing, isolation, and early treatment. To avoid further damage to the economy, in the framework of smart distancing, we decided a step-by-step reopening of businesses. I would like to underline the critical importance of global solidarity and international collaboration to overcome the pandemic and to ensure timely, affordable, and equitable access to medicines and vaccines. Unilateral sanctions are inhuman impediments that inflict unnecessary suffering and pain. The U.S. must be held to account for its ever-intensifying genocidal sanctions against Iranian and other affected nations. The year 2020 is named the year of nurses and midwives, and I would like to commend all frontline health workers, particularly those who dedicated their lives to save COVID patients. Thank you for your attention.
Thank you, Honorable Minister. Madam President, we've now moved into the second session that we had made inscriptions for. I'd just like to point out that there are a number of countries who had inscribed for the second session, and we would like to accommodate that request, given that they inscribed on the list much earlier than some of the countries that we have now for this session. And to that end, we would like to invite, after Norway, Mexico, Canada, Nigeria, USA, Honduras, Zambia, Cuba, Brazil, Peru, and then Panama. So we'll give the floor to Norway, and then we'll invite these names that I've just read out. Thank you. Norway, you have the floor.
President, we are amidst one of the worst crises of our time. We are profoundly grateful to all those who put themselves at risk to save others. We must remain focused. We must uphold health and human rights while minimizing effects on the economy and social well-being. Afterward, we must evaluate and improve. The World Health Organization has Norway's full support. President, crisis worsens existing inequality. We must therefore protect the most vulnerable and honor humanitarian principles. We must ensure access to essential health services, including sexual and reproductive health service. Keep addressing non-communicable diseases and violence and abuse. We will leave no one behind. It is our shared duty to contribute to the rapid development of a vaccine and to commit to making it globally accessible and fairly distributed. Norway, as a co-lead for the COVID-19 Global Summit, is dedicated to work with others to realize this goal. To prepare for future outbreaks, all global health actors should contribute to strengthening health system. The SDGs Global Action Plan can play a crucial role. President, we had to shut down our societies, but not our hearts. Solidarity and militarism will prevail. Let us use this opportunity to come out as a stronger community on the other side. Thank you.
Thank you very much, Honorable Minister. May I now invite Mexico to give their statement. You have the floor, Mexico.
Embajadora Keba Bain, Presidenta de la 73ª Asamblea Mundial de la Salud. Doctor Tedros Adhanom Ghebreyesus, Director General de la Organización Mundial de la Salud. Ministros, jefes de delegación, representantes de organizaciones internacionales, delegados, señoras y señores. Me es muy grato dirigirme a ustedes, colegas de todas las regiones del mundo, en esta ocasión histórica que nos convoca a celebrar la 73ª Asamblea Mundial de la Salud en forma virtual. Aunque separados en espacio, nos encontramos más unidos que nunca.
Okay, we will take that again. May I now kindly invite Canada to take the floor, to be followed by Nigeria. Canada, you have the floor, please. Okay, we would take Nigeria and then come back to Canada and Mexico. Nigeria, you have the floor, please. Okay, we don't have Nigeria. We'll come back to that country. We will come back after a short recess. I think we have a slight technical challenge. We would. Is Mexico ready? Mexico, you have the floor.
Embajadora Keba Bain, Presidenta de la 73ª Asamblea Mundial de la Salud. Doctor Tedros Adhanom Ghebreyesus, Director General de la Organización Mundial de la Salud. Ministros, jefes de delegación, representantes de organizaciones internacionales, delegados, señoras y señores. Me es muy grato dirigirme a ustedes, colegas de todas las regiones del mundo, en esta ocasión histórica que nos convoca a celebrar la 73ª Asamblea Mundial de la Salud en forma virtual. Aunque separados en espacio, nos encontramos más unidos que nunca, con un objetivo en común: hacer frente a los embates del coronavirus, anteponiendo siempre la salud a los intereses comerciales, así como proteger la integridad de nuestro personal sanitario y prepararnos para lo que vendrá después del primer brote. El SARS-CoV-2 vino a desenmascarar otras pandemias iguales o más graves que el virus mismo, tales como el sobrepeso, la obesidad, la diabetes, la hipertensión arterial, siendo todas determinantes prevenibles que merman la calidad y la esperanza de vida de nuestras comunidades. No podemos ni debemos volver a la normalidad. Necesitamos voltear al pasado y replantearnos nuestros hábitos y estilos de vida. No existe mejor oportunidad en la historia para incrementar nuestros esfuerzos a favor de la buena alimentación y asumir la salud medioambiental como determinante indivisible de la salud humana y colocarla permanentemente en nuestras agendas bajo los compromisos de la Agenda de Desarrollo Sostenible. México reconoce el importante esfuerzo de la Organización Mundial de la Salud para llevar a cabo esta reunión. Estamos convencidos que, en este momento tan complejo, tenemos la oportunidad de orientar y coordinar aún más la respuesta mundial de forma integral y coordinada, basada en evidencia científica, voluntad política y solidaridad internacional. Se ha hecho evidente la necesidad de consolidar los sistemas de salud centrados en las personas y guiados por los principios de justicia y solidaridad como la base para garantizar la salud como un derecho sin distinciones de ningún tipo. Este es el cimiento para fortalecer nuestra preparación ante futuras amenazas sanitarias. México ha comenzado, bajo la administración del presidente Andrés Manuel López Obrador, una transformación del sistema de salud con el objetivo de convertir el derecho a la salud en una realidad, fortaleciendo la atención primaria de la salud de forma integral y construyendo un sistema que no presente barreras en la prestación de los servicios. Esto ha permitido tener una respuesta a la pandemia cercana a la gente, privilegiando el acceso a los servicios oportunos de salud, buscando centrar la respuesta en las comunidades. En este espíritu, México trabaja para respetar los derechos humanos de la población, integrando una perspectiva de género en todas nuestras acciones. Es vital no permitir que el COVID-19 sea factor de discriminación, estigma o xenofobia, afectando a las poblaciones más vulnerables. Asimismo, México destaca la extraordinaria labor del personal de salud para enfrentar esta crisis. Nos parece ineludible reconocer, en el marco del Año Internacional de los Profesionales de Enfermería y Partería, su papel central para el fortalecimiento de los sistemas de salud y alcanzar las metas planteadas en el objetivo 3 de los ODS, incluida la reducción de las desigualdades en el acceso a la salud. Las desigualdades también han estado presentes en el suministro de equipos médicos. Por ello, México, reconociendo los principios de solidaridad y cooperación como pilares de la acción global, presentó ante la Asamblea General de Naciones Unidas un proyecto de resolución para garantizar, a través de la solidaridad y la cooperación internacional, el acceso mundial justo, transparente, eficiente y oportuno a herramientas preventivas, productos sanitarios, vacunas y otros equipos médicos necesarios para hacer frente a la pandemia. Bajo estos mismos principios, México participa en el ensayo Solidaridad de la OMS a fin de encontrar un tratamiento eficaz contra el COVID-19 y asegurar el acceso equitativo a dicho tratamiento. México refrenda su compromiso y hace un llamado para que, basados en el derecho humano a la salud, continuemos colaborando para superar esta emergencia y fortalecer la capacidad global para hacer frente a las amenazas futuras a la salud mundial. Debemos trabajar como un todo, una salud mundial para todas y todos en todos los rincones del mundo. Si trabajamos unidos, lograremos salir adelante. Gracias.
Thank you very much, Minister. We will now invite Canada to be followed by Nigeria. Canada, you have the floor, please.
Honorable Ministers, distinguished delegates, I'm honored to address the World Health Assembly on behalf of Canada. 2020 est l'année internationale des sages-femmes et du personnel infirmier. Je tiens donc à souligner le rôle essentiel qu'ils jouent, eux et tous les travailleurs de santé de première ligne dans la réponse à la COVID-19. The ever-evolving COVID-19 pandemic requires us to learn constantly, to share widely, and to act quickly to support an evidence-based response. Global cooperation on health has never been more important, and that's why Canada values the leadership of the World Health Organization. Our institutions are helping us accomplish together what we cannot do alone. This includes collaborative research and development efforts to make a future treatment or vaccine available, accessible, and affordable. The COVID-19 pandemic has reinforced the importance of working together to build a global health community where everyone is included. A world where we are better able to support the most vulnerable and at-risk populations. We must do better to reduce inequalities related to age, gender, and income that have been intensified by this pandemic. And we must continue to address mental health and well-being. No one should suffer in silence. Strong and resilient health systems and primary health care help us to prepare better, respond more quickly, and recover faster. We can and we will learn from this pandemic, including through a comprehensive post-crisis review, to ensure we are all better prepared the next time. As we build a new normal, Canada is ready to do its part. Thank you.
Thank you, Canada. May I now invite the US to be followed by Nigeria and then Honduras. United States of America, you have the floor.
Director General Tedros, fellow ministers, COVID-19 has tragically taken hundreds of thousands of lives, impacted millions of people, and done deep damage to the world economy. We must be frank about one of the primary reasons this outbreak spun out of control. There was a failure by this organization to obtain the information that the world needed, and that failure cost many lives. The United States welcomes the assistance provided by our friends during this crisis, and we have been proud to allocate over $9 billion that will benefit the global COVID-19 response, including more than $500 million in planned investments by my ministry to support more than 40 of the most at-risk countries. The United States launched the first human vaccine trial and reported the first positive results from a therapeutic clinical trial. These successes and the transparent way in which we share them will benefit the whole world. WHO's operations must be transparent too, and we support an independent review of every aspect of WHO's response to the pandemic. We all must come together to ensure that WHO fulfills its key mandate and that member states comply with the international health regulations. In an apparent attempt to conceal this outbreak, at least one member state made a mockery of their transparency obligations, with tremendous cost for the entire world. We saw that WHO failed at its core mission of information sharing and transparency when member states do not act in good faith. This cannot ever happen again. The status quo is intolerable. WHO must change, and it must become far more transparent and far more accountable. It is also critical that Taiwan participate as an observer at the WHA to bring the helpful perspective regarding their effective and exemplary response. WHO barred Taiwan from participation in 2016, just a few months after Taiwan's free and fair elections. The health of 23 million Taiwanese people should never be sacrificed to send a political message. Although we are all focused on the immediate response, we need a more effective WHO right now to help win this fight and demonstrate to our citizens that we are working to prevent such catastrophes in the future. The United States sends our best wishes and open offer of cooperation to each of you in our shared efforts to defeat this pandemic and protect the health of each nation around the world.
Thank you very much. We will now invite Nigeria to be followed by Honduras. Nigeria, you have the floor, please. Nigeria, Honorable Minister, are you with us? Okay. Could we kindly move to Honduras to be followed by Zambia? Honduras, you have the floor, please.
En mi condición de secretaria de la Salud de la República de Honduras, mi país se complace en participar en la 73ª Asamblea Mundial de la Salud, una asamblea fuera de serie sin duda alguna que se ha llevado a cabo en tiempos en los que la solidaridad y la cooperación entre los países son más necesarios e indispensables que nunca. Hoy nos enfrentamos a desafíos sin precedentes. El reto más grande es disminuir el impacto en la salud y en la vida de las personas y a la vez disminuir los daños colaterales sobre nuestra economía y en los sectores más vulnerables. A medida que la pandemia se propaga por los países, es imperativo estrechar los lazos de cooperación y solidaridad, incluyendo los países que han desarrollado acciones exitosas, como China-Taiwán, que se ha convertido en un modelo para muchos Estados miembros. No dudamos que al incluirlos como socios, la OMS y los Estados miembros nos beneficiamos enormemente de su experiencia. Honduras reconoce el liderazgo excepcional de la Organización Mundial de la Salud en la respuesta y contención de COVID-19, ya que han estado trabajando mano a mano con nosotros en el abordaje de esta tremenda crisis sanitaria. Todos los países debemos aprovechar nuestras experiencias para construir respuestas globales basadas en capacidades y fortalezas de cada uno, pero en solidaridad y unión para avanzar y vencer todos juntos esta pandemia. Quisiera aprovechar esta oportunidad para rendir un homenaje a los trabajadores de la salud que en Honduras y en todos los países dedican su vida al cuidado de la salud de la población. Ellos merecen que centremos nuestros esfuerzos en continuar facilitando las condiciones para que estén protegidos mientras desarrollan su trabajo. Para ello es necesario la solidaridad de todos los países y de la industria en general. Muchas gracias.
Thank you very much. May we now invite the Minister of Health for Zambia to be followed by Cuba. Zambia, you have the floor.
Mr. President, honorable ministers, distinguished ladies and gentlemen, Zambia, the stewardship of the Republican President, His Excellency Dr. Chagolungu, has been her health system to reposition universal health coverage anchored on primary care. In this transformation agenda, public health security is a high priority for us and led to the birth of the Zambia National Public Health Institute, which is the technical arm that oversees this surveillance, epidemic preparedness, and response. In response to the COVID-19 outbreak, Zambia activated the Public Health Emergency Center and set up the incident management system. A COVID-19 response plan based on the whole government, whole society collaborative approach has been crafted that seeks the delicate balance between allowing key areas of the economy to run while abating a public health crisis. The response focuses on surveillance, case detection, health management, diagnosis, infection prevention and control, human capital enhancement, and risk communication and engagement. At this effect, Zambia has recorded 761 cases of COVID-19, with 7 related deaths and 192 recoveries. Zambia calls for perpetuated solidarity and unity of purpose. Let the world liberate resources to enhance the expansion of laboratory testing platforms, full procurement for PPEs, and invest in research for vaccines. Zambia appreciates the role World Health Organization has played and the leadership of Dr. Tedros in pitching universal coverage and health emergencies at the apex of the global health agenda. We further thank all the health workers that have battled COVID-19 at the front line and pay our respect to all those who paid the ultimate price. Finally, Zambia reaffirms its call for health system strengthening, for universal health coverage, and enhanced efforts to fight HIV/AIDS, TB, malaria, NCD, maternal deaths, and child deaths. Together, we can defeat COVID-19, push the UHC agenda, and make the world a safer place to live in. I thank you.
Thank you, Honorable Minister. We will now invite Cuba to be followed by Brazil, Peru, and Panama. Cuba, you have the floor, please.
gracias, señora Presidenta, estimado director Tedros, distinguidos ministros y ministras de salud, delegados. La COVID-19 es un reto global que no distingue fronteras, ideologías o niveles de desarrollo. Ha puesto a prueba los sistemas sanitarios de todo el mundo, así como nuestra capacidad de respuesta ante eventos epidémicos. Cuando en Cuba se diagnosticaron los primeros casos, el pasado 11 de marzo, ya se aplicaban medidas del Plan Nacional elaborado en consonancia con los protocolos y buenas prácticas de la Organización Mundial de la Salud. Su